Thank you.
Thank you.
Awesome. Good afternoon, everyone, and welcome to the second annual Wisconsin Rural Economic Summit. My name is Brandon Hofstede, and I am the Community Economic Development Program Manager with the University of Wisconsin-Madison Division of Extension. It is my pleasure to open the summit and to welcome hundreds of fellow participants from over 150 different Wisconsin communities. Today's summit is focused on rural Wisconsin and is meant to examine the state's diverse rural places. Using the latest research and data, we will focus on Wisconsin's rural economy. The summit includes an overview of the latest economic and demographic trends, an examination of labor force trends and workforce shortages, a focus on tech entrepreneurship in rural communities, and discussions on rural healthcare and rural childcare. We'll wrap up today's event with a discussion of the fourth wave of economic development and its importance to rural communities. And we are very excited that you're able to join us for these conversations today. Before we begin, I'd like to thank our event sponsors, including the Wisconsin Economic Development Corporation, Wisconsin Early Childhood Association, Rural Wisconsin Health Cooperative, and the University of Madison Division of Extension, including the EDA University Center, the Community Economic Development Program, and the Local Government Education Program. And a special thank you to the U.S. Economic Development Administration. Today's meeting was made possible in part by a grant from the U.S. EDA in support of the the EDA University Center at the University of Wisconsin-Madison. A couple of housekeeping rules prior to starting or introducing our first presenter. Today's meeting is being recorded. And final video will be posted on our website towards the end or after the event. You will receive an email from us with that location. Also, we are using the meeting format, which means that you'll be able to see other participants. However, for your convenience, we will be spotlighting presenters, so they will show up at the top of your screen. Today's summit does have closed captioning if you require or if you need that. You can find that at the bottom. It should say CC at the bottom banner. And you should be able to choose that if you so choose. And as a friendly reminder, please be sure to mute your microphones when you're not speaking. We will open up the floor for questions if there's time after our presenters. If we are unable to answer questions during that time, the presenters will either answer in the chat or we can have a follow-up conversation via email with any more in-depth conversation or questions. You can choose to raise your hand when we get to that point, or you can just drop a chat question into the chat at any moment. Myself, again, my name is Brandon Hofstede, and my colleague, Kristen Runge, both of us should show up at the top of your screen. When we go to the participant list, you can drop us a private chat if you have a question that you don't feel comfortable asking in front of the entire group. So with that, I would like to introduce our first speaker, Dr. Steve Deller. Steve is a professor of agricultural and applied economics at the University of Wisconsin-Madison and a community economic development specialist with Extension. Steve's work focuses on modeling community and small regional economies to better understand the changing dynamics of the economy, assess the impacts of those changes, and identify local economic strengths, weaknesses, opportunities, and threats. And today, Steve will kick off our summit by discussing general economic trends in rural Wisconsin. So Steve, the floor is yours.
It would help if I unmute myself. Good afternoon, everyone. What I'm going to give is kind of a long-term perspective of what's happening to the rural economy within Wisconsin. And we have 1 year of data that we can talk about what, COVID and how COVID is kind of impacting. So I'll kind of point to that a little bit, but the impact of COVID is not going to be a focal point of the discussion today. One of the things that we have to kind of think about a little bit is when we talk about rural Wisconsin, we have to kind of define what we mean by rural. And oftentimes it's in the eye of the beholder. One of the primary definitions that we use is kind of non-metropolitan counties as determined by the Office of Management and Budget. What they do is that they have a standard definition, and they say that any county that has at least one place, and by place I mean a town, a village, or a city that has 50,000 people or more, that is a metro, that county is a metropolitan county. They also say that any adjoining counties that are a high degree of connection, social and economic integration is also part of that metropolitan area. And what they mean by this, or the way that they measure this, and they implement this, is that if 25% or more of the labor force commutes to the core county, then it's included in metropolitan area. So here, what they're saying is that if you're an adjacent county to a metropolitan core and 25%, then you're part of that metro. Essentially, you're a glorified, or not glorified, you're a bedroom community to that metro core, so you're included. Now, the reason that the non-metropolitan metropolitan is important, because this definition or this classification is often used for a lot of federal programs in terms of eligibility for different types of programs. So this is kind of written into law, much like the Consumer Price Index is written into law in terms of how we measure inflation. Although economists say that's really not the best measure of inflation, it's the one that's written into law in terms of how we implement a lot of our policies. Now, this is a mapping, if you will, of non-metropolitan counties. Now, look at Wisconsin. Look at Dane County in particular. That's at the bottom center. That's where Madison's at. Look at the counties that are around it. Rock County, that's its own metropolitan area because of Janesville. But look at Columbia County to the immediate north, Iowa County to the immediate west, and Greene County to the immediate south. All of those are included in the Dane County or the Madison metropolitan area because at least 25% of the people that live in those counties commute into Dane County. Now, if you go in and you talk to somebody in Iowa County and they say, hey, you live in a metropolitan area, they're going to say, no, we don't. We live in a rural area. They self-identify as living in rural, but from a definitional perspective, they are part of the metropolitan. Okay. Another way to do this is the Census Bureau has another definition of rural. And what they say, they look at individual places, and a place being a town, a village, or a city. And they say that if the place has less than 2,500 people, it's essentially a rural place. More than 2,500, it's an urban place. What this is a mapping of is the percent of the people within a county that is living in a rural place. You see that there is overlap with the non-metropolitan, but you start to get a little different insight here, particularly if you look at Columbia County and Sauk County. Remember, Columbia County is part of the Dane County metropolitan area. Sauk County is not. But if you look at the percent of rural, those two counties are very, very similar. Okay, but the way that they're defined by the OMB, they are part of metropolitan. Another way to look at it is population density. This is the number of people per square mile. And you can notice here that Wisconsin, you can see Dane County kind of pop up a little bit. You can see the Milwaukee metro area. You can see the Fox Valley area. You can see kind of the effect of the Twin Cities. But notice Iowa County here. Iowa County has a fairly low population density, but yet it's classified as a metropolitan. So one of the issues that we've got here is, what do we mean when we talk about rural Wisconsin? Okay, it really is in the eye of the beholder. Now, for the analysis that I'm going to be talking about here is I'm going to be using the OMB non-metropolitan. So essentially for this kind of time period that I'm looking at is that if you were classified as a non-metropolitan county in 2010, then you're a non-metropolitan throughout the entire time period. Okay, so it's that mapping on the left side of the screen that is going to be kind of what we're using as a benchmark here. One of the things that, when economists look at how the economy is changing, there's a number of indicators that we look at. And one of the basic ones is population. It's what's happening to population. And what we can see here is the overall US population growth rate. That's that kind of light gray bar. You can see that, strong growth, consistent growth. Non-metropolitan US, rural US, since I just kind of said have to be careful about non-metropolitan rural, they're different things. I'm going to use the two terms interchangeably. Look at the dark line there. That's non-metropolitan or rural US. Wisconsin, non-metropolitan is the dark red one, and then the orange one is metro. And you can see here that there was actually a couple of periods here where rural Wisconsin actually was doing pretty good through the 1970s, the 1990s, up until about 2008. There were two time periods where rural Wisconsin was really kind of not doing very well. One was the 1980s. That was the farm crisis of the early 1980s. And also that's when a lot of manufacturing started to go overseas, and Wisconsin was hit very hard by that. The other is, notice since the Great Recession, rural Wisconsin has really not recovered. But you can say the same thing about the rest of rural America. Rural America has really not come back from the Great Recession. Now, this is simply a comparison of Metro Wisconsin and non-Metro Wisconsin. The same chat, I'm just cleaning up the graphic here a little bit. The impact of the Great Recession on rural Wisconsin has been pretty significant. It's basically, the rural economy as measured by population is basically stagnant. It's not really going anywhere up or down, okay? This is, again, the same data, but we're looking at non-metropolitan US, the whole of rural US, that's that kind of light gray line. Non-metropolitan Wisconsin, again, the red line, the Badger red line. And then the Great Lakes non-metropolitan area. To me, what we're saying here is that rural Wisconsin, compared to the Great Lakes states, we're actually doing okay. We're kind of tracking along with what the rest of rural areas is doing, but we're doing better than the Great Lakes states. Indeed, when you look at the Great Lakes states, rural Great Lakes, it's actually one of the worst performing rural areas in the nation. The Mountain West, the Far West, the Northeast, the Southeast, they're all kind of doing okay, but the Great Lakes is really not doing very well. So the question really is that Wisconsin kind of lagging behind here? Is this because of the region that we're in? Okay. The other way to look at this is employment. Okay. Now, a couple things here. One is that if you look at non-metropolitan US, that dark line, notice that rural Wisconsin is actually doing pretty good. We're actually kind of keeping up. We're doing better. We're tracking with the US. We're tracking with non-metropolitan again until we hit the Great Recession. And then we simply don't recover very quickly. We're kind of lagging behind. Also notice, look, you can see what's happening with COVID. That drop off right there in 2020, the last year of data that we have, that's COVID coming in. Notice that in the population chart, we really didn't see any effect of COVID. Well, people weren't moving around a whole lot during COVID because we basically locked into place. Okay, how this plays out into the future with telecommuting, we don't know yet. Okay, there is some opportunities there for rural that we can talk about a little bit later. Excuse me. Okay, now this is again a comparison between urban and rural Wisconsin. Notice that in terms of employment, all the way from 1969 up through until the end of the Great Recession, the two track each other very, very closely. Okay, rural Wisconsin has actually been fairly robust in terms of the rest of the state. But look at the Great Recession. We still haven't recovered. Urban Wisconsin has recovered and is above where it was before the Great Recession. And again, you can also see the effects of COVID hitting here. Okay. Now, one of the things that is one of the hot issues right now within Wisconsin and across the US is the labor force and the ability of employers to find workers. What this is a simple population to employment ratio, simply taking the number of people, excuse me, dividing it by the number of jobs. And notice how it's trending downwards throughout this entire time period. What this is saying is that we are generating more jobs than we have people to fill those jobs. Throughout the 70s and the 80s, the way that the economy was able to kind of compensate for that is we had women entering the labor force in record numbers. Okay, we were able to sustain that, generating more jobs than people because of that. Okay, the problem though now is that we've tapped out that labor pool. Okay, women in the labor force is pretty much peaked out. We see little blips up and down, particularly through COVID, but that general pool of labor has been tapped out. The other problem that we have right now is that the birth rate compared to the death rate is getting closer and closer together. Okay, we're simply not adding to the pool of labor the way that we had been for many, many years. The other problem that we have is a downtick in the number of immigrants that are coming into the US. So essentially what we've got is a long-term trend here that is really starting to have a strong impact right now. This is the same figure looking at the US non-metro, Wisconsin non-metro, and the Great Lakes. The labor force issue in rural Wisconsin appears to be stronger and more tight than other parts of rural areas, the rural US or the rural Great Lakes. So the labor force issue, the labor shortage issue seems to be more pronounced in rural Wisconsin than other parts of rural America. Okay, now what about income, per capita income? This is adjusted for inflation. And you can see that the growth rate between urban Wisconsin and rural Wisconsin, they're tracking each other. But per capita income tends to be higher in urban than in rural. But notice how per capita income in rural Wisconsin is actually better than the national average for non-metro. We're actually doing pretty good. The other thing that's really odd is look at what's happening in the COVID year, 2020. There's actually a strong uptick in per capita income. Now, that kind of is, wow, why would that happen? We go into an economic recession, jobs drop, but yet per capita income goes up. Well, that's essentially the CARES Act and all the various programs that were implemented during the pandemic to try to keep the economy afloat. So that increase is actually due to federal programs, federal stimulus programs that deal with the COVID crisis. This is again just looking at Wisconsin. You see the same kind of a pattern here. If you look at the non-metro Wisconsin compared to the rest of the US and the Great Lakes, again, you can see the per capita income in Wisconsin is a little bit higher than our counterparts in other parts of rural areas. So in some regards, rural Wisconsin's actually kind of doing okay in comparison, okay? The other measure that we now have is GDP per capita. This is an important measure because this is kind of the measure at the national level that we use to kind of measure whether the economy is growing or in recession. Okay, and the Bureau of Economic Analysis in the U.S. Department of Commerce has been collecting this data now for a couple of years. And the time period is long enough now that we can actually start to get some ideas here. So this is GDP per capita. And you can notice that rural Wisconsin is tracking along the rest of rural America pretty closely, but it's behind both metropolitan Wisconsin and metropolitan US. You can also see the effects of COVID jumping in, a drop, okay? So when you see a drop in employment and a drop in GDP, you would think that per capita income would also drop, but it didn't. It actually went up because of those federal programs. Now, the question is that how much does that feed into the current kind of picture around inflation? And we could spend all afternoon talking about that. But inflation right now really is kind of composed of three parts. One is the effects of the supply chain, problems with the supply chain, that's still working its way out. There are still shortages. The second is that perhaps that CARES program, that jump in per capita income, the aggressiveness of the Federal Reserve Bank, maybe they put their foot on the gas just a little too long, and that's kind of adding to inflation. The third is that there's growing evidence that a lot of businesses are taking advantage of the supply chain shortages and upping their prices. For example, in the beef industry, some of the four major beef processing companies in the US are actually reporting record profits while they're increasing prices. So there's something going on there that we need to be aware of. Okay, so in conclusion, some of the things we think about rural Wisconsin or rural America is that we have to think, what do we mean by rural? And in order to do data analysis and do comparisons, we have to have some kind of meaningful definition. Okay, but we're really talking about a spectrum here. Okay, population growth has stagnated. We have not fully recovered from the Great Recession. The question is, why? Why has rural Wisconsin continued to lag behind? Okay, historically, employment growth for rural Wisconsin tracks urban Wisconsin, except post the Great Recession. What has happened over the past 10 years that rural Wisconsin is not performing the way that it historically does? Okay. Indeed, rural Wisconsin, despite the fact that it's still kind of struggling to recover, it's doing better than a lot of other rural places in the US, particularly the Great Lakes region, of which we are part. Okay. We are generating more jobs than we have people to fill them. This has been a long-term trend. Remember, before COVID, one of the issues that a lot of businesses were dealing with was a labor shortage. This has come back to us. Okay, this labor shortage that we're experiencing right now is not new. Okay, it has just become a bit more intense. Now, there's long-term trends that are at play here. The birth rate has been declining. We can also, the death rate has been basically flat, but with the baby boomers aging, we can actually expect the death rate to go up a little bit. So we could be in a situation where we're actually seeing population decline, because we could be experiencing what Japan kind of experienced over the last couple of decades. They simply were not generating enough bodies to fill the jobs. Okay, immigration policy comes into play here. Okay, we could spend a large amount of time talking about that. Okay, the evidence from COVID impacting the economy is really pretty clear. Okay, we see a drop in employment. We see a drop in GDP, just as we would expect. We see that occurring across urban and rural. Indeed, there isn't much of a difference between urban and rural in terms of how COVID is impacted. Okay, but that uptick in per capita income really does make the COVID recession different from all other recessions. Okay, the COVID recession, we can't really go back and look at previous recessions and learn from those previous recessions, like the Great Recession, because this current one that we're technically out of is so unique. It's so different that a lot of what we're experiencing right now, we don't have any good historical references to go back to until you go back to the Spanish flu of 1917. And the economy was so fundamentally different then than it is now that we're kind of learning as we go on a large extent here. So rural Wisconsin has historically been doing pretty good, particularly compared to urban Wisconsin, except for the past 10 years. Something has happened that has fundamentally changed the growth trajectory of rural Wisconsin. And that's where a lot of our research is occurring, is to try to figure out why that is. I'll stop there, and I think we may have time for a question or two.
Yes, thank you very much, Steve. We do have a few minutes, so I know there were some questions in the chat, but I will open it up if there are questions that folks would like to ask.
Remember to unmute yourself if you have a question.
We did have a question about a slide with the GDPs. One of our participants asked, was that national or state GDP on the slides? Go ahead.
That is, now I got to go back and look at it. It's actually non-metropolitan and metropolitan. Okay, so it's non-metropolitan US, metropolitan US, and then non-metropolitan Wisconsin and non-metropolitan US. We actually, they now have that data available for individual counties going back, what was that, 15 years? So that's a new indicator of economic performance that we didn't have 5 years ago. So it adds another, well, as an economist, I like it because the more data we have, the better. But it's, so yeah, I hope that answers the question.
And then we had a question, which states are in the Great Lakes category?
Oh, you would ask that. Minnesota, Wisconsin, Illinois, Indiana, Michigan, Ohio, Pennsylvania. Oh, is New York? I'm not sure if New York is in the Northeast or is in the Great Lakes. So think about the Great Lakes. Any state that touches one of the Great Lakes is included in the Great Lakes. But I'm not sure about New York and Buffalo there. They might be in the mid-Atlantic.
We also have a comment, Steve, I don't know if you can see that, but it's from Mark, and it says, I work across southern Wisconsin counties and have found that broadly, if not for immigrants, the labor shortage would be far worse. And I see this especially across dairies, agriculture, service. The biggest labor shortage is health and elderly care. So I don't know if you want to comment.
Yes, I think that we need to have a deeper discussion about immigration and kind of being more open to immigrants coming into the US. You have to realize that a lot of the jobs that we're generating tend to be lower income jobs. And those businesses that are in that kind of a labor market are really, really struggling. It used to be that people thought that $15 an hour was a really good job. I think people are coming to the realization, no, it's not. And a lot of folks, particularly domestic folks that have been born and raised here, they're looking at $15 an hour and they're saying, I'm not going to take that job. I can do better than that. And so a lot of those lower income jobs, I mean, those are a lot of they're great starting jobs for a lot of immigrants that are coming into the US that are trying to get established, and then they can move up the economic chain. And I think too often the immigration debate is there's a lot of red herrings being thrown around when we talk about immigration. And I think a lot of those red herrings are kind of distorting the broader question. But without those immigrants, the labor shortage is going to be even more severe than what we're experiencing now.
And one more question. Does the described labor shortage compare jobs to the total population or the workforce? And what is the trend of population in the labor force?
Okay, this is, I'm using population, not labor force, okay? Because it's readily available and it's available over time, and it's a clean, simple measure. If you look at trends in labor force participation rates, you will get differences, okay? Matter of fact, that ratio will look even worse. Now, Mattcuris, a colleague of mine, correct me if I get this wrong, Matt, but the labor force participation rate in Wisconsin has historically been pretty stable, okay? The labor force participation rate in Wisconsin tends to be above the national average. And it fluctuates a little bit, but it hasn't really changed fundamentally over the last few years. So if I redid those population employment with labor force employment, you would get the exact same story. If you put the two charts side by side, they'll look a little different, but the basic takeaway point will remain the same. This is one of the things that is kind of a misperception, that there are all these people sitting on the sidelines. Matt's done more work on this than I have, but even if we return to the historic levels pre-COVID, we'd still have a labor shortage. That labor shortage issue is not new. It's been around for a number of years, and it's going to get worse. That's why so many companies are looking at automation. That's why when in the dairy industry, robotic milking machines, when those things first came out, it was pretty Star Trekky, Star Wars type stuff. Go, man, that's never going to happen. Well, it is happening. It's happening because as new technologies are introduced, as more people start to use it, the costs start to come down. And increasingly, a lot of dairy farms are simply looking at the labor force issues and they're saying, I got to invest in the robotics. Grocery stores, how many go stores, how many do their own self-checkout? A lot of that is because these companies are trying to address labor shortages. I think we're going to see more and more and more of that. I just stopped by coming home from work the other day. I stopped by to get a sandwich to bring home for my wife and I, and it was, you had to buy at a kiosk. And I'm thinking, you know, is this because of COVID or is this because labor shortages? I think they might have introduced the kiosk to place the order as kind of a response to COVID. And I think more and more companies are starting to say, hey, that's one less person we have to employ. So I think that there's a long-term trend here.
Great. So just to keep it moving along, and just as an FYI, we have a lot of people who touch the Great Lakes, and they corrected you in terms of what was Great Lakes state. So, which
one did I?
I'm just kidding. It was New York. So there was someone who said that it probably is there. Yep. So with that, thank you, Steve, very much.
Thank you.
And we'll actually turn it over to our next presenter, David Egan Robertson. David is a demographer with the Applied Population Laboratory at UW-Madison. David specializes in applied demography techniques, U.S. Census data for Wisconsin, and population estimates and projections. And today, David will go a little bit deeper on some of those things that Steve was just discussing when it comes to rural population growth trends within the state of Wisconsin. So David, the floor is yours.
Okay, thank you. Can people see my first slide okay?
Ken.
Okay, good. Let me just take a moment to get set up a little bit differently here. And thanks to Steve, he did a wonderful job of describing, you know, how do we define what's rural and what's not rural. He did a very nice job on that. In my presentation here today, I'm going to bring in the first round of local level data that's been released from the 2020 census. A couple of caveats, there's not a lot of age detail yet. You may have heard what's been released, it's called the redistricting data file. So we only have age 18 and up in 0 to 17. So there's not much age detail yet. And again, the data for 2020 has not yet been coded to sort of urban and rural areas. So I'm going to rely, as Steve did, on the use of the metropolitan and non-metropolitan definitions for counties in the state. And let's see. I'm having a little trouble advancing my slides here. Please hold on. Let me try this. There we go. Okay. All right. Some of you may be familiar with the Applied Population Lab, but for those who aren't, we're within the Department of Community and Environmental Sociology within the College of Ag and Life Sciences. So we have 7 full-time research and outreach. Randy Stalker, who's an extension professor, is our faculty director. And we see ourselves as demographic data providers and facilitators. Sort of some key concepts about being applied demographers. We assist people in with the interpretation of data or developing data such as estimates and projections to inform public policy and practice. And we help people understand the relationship between data and place. So let me just start with sort of state level analysis. I was asked to speak about recent trends, and it's always kind of dangerous to ask an applied demographer what's recent. I tend to think in sort of 20 and 30-year periods of time. I was interested to see that Steve went back all the way 50 years. So I guess I'm sort of trailing behind him a little bit. But for talking about state trends, I'll talk about the last 3 decades, the 90s, 2000s, and 2010s. And then for county level trends, I'll talk about the last 2 decades, the 2000s and the 2010s. and going back a decade or two, it provides context for what's happened most recently. So first in this slide, I hope people are seeing a graph with the state populations here from 1990 through 2020. You can see we had pretty substantial growth in the 1990s, about 470,000 people. And that that tailed off in the 2000s to about 320,000 people. And this last decade, you can see it's the least numeric growth of the last 3 decades, a little over 200,000. The percentage change there, the 3.6% of the last decade, that is the smallest percentage increase since statehood in a decade. 1980s was actually slightly smaller in terms of numeric change. It was the time of the Rust Belt recession, the late 70s, early 80s, or population didn't grow a lot then. But this last decade is the lowest percentage change we've had since the state was founded back around 1850. So, and just to give you a sense of what's going on with Wisconsin in comparison to the entire US. So since 1990, Wisconsin's grown about 20%. And you can see here from this graph that the country itself has grown by about a third. So we have lagged national growth a bit. However, when you compare us to our sort of nearest neighbors, all the states that join Wisconsin, Wisconsin's doing okay. And Steve Deller kind of alluded to this a little bit too. You can see from this graph, Minnesota has grown about 30% over the last 30 years. And as mentioned before, Wisconsin's up about 20%. Iowa's gained 15%, Illinois 12%, and Michigan about 8%. So you can see among our neighbors, we're actually sort of running in second place over the last 30 years in terms of percentage change. So what about when we start looking at the counties? And again, all my discussion here in counties, I'll be aggregating together the state's metropolitan and non-metropolitan counties. You can see over the last couple of decades here that in our metropolitan counties, there are 27. So 27 of the 72 counties are considered metropolitan in Wisconsin, so a little more than a third. Those as a group grew about 7% in the 2000s, and it slowed down a bit in the 2010s, down about 4.3%. With the non-metropolitan counties, the other 45 counties in the state, you can see growth was quite a bit slower, and Steve, I think, may have highlighted this as well. Only about 3.3% in the 2000s, and then that percentage increase change actually basically was cut in half during the 2010s. And just to sort of then say, okay, what in recent decades, in terms of the state's growth, how much has sort of accrued to metro areas and how much has accrued to non-metro counties? As you can see here in the 2000s, about 85% of the state's growth accrued to those metropolitan counties and only 15% to the non-metros. In the most recent decade, it's actually become even a little bit wider apart. The metros added, within the metros, 89% of the state's gain accrued to those counties. Only about 11% of the state's gain went to non-metros. So you can see here over time, again, not a big amount of change, that the metro counties hold about 3/4 of our residents and the non-metropolitan ones about 1/4. So now let's just breaking down now the non-metropolitan counties, those 45 counties in the state. There are a number of different ways we can do that. There's an additional concept called micropolitan areas, sort of similar to the metro areas, which Steve laid out. You have to have at least a core population center of at least 50,000 people. Micropolitans have to have a core population area of 10 to 50,000. So these are counties and outlying counties, as Steve mentioned, if they're connected by commuting and employment. So in Wisconsin, some examples of micropolitan counties are like Manitowoc and Portage and Wood County, even Grant County. with Platteville being, kind of a core center for that community with the university campus there. And so in the non-micropolitans, those are counties like Adams and Juneau, Richland, most of the counties up north, they don't have sort of a central population core of at least 10,000. So looking back over the last couple of decades, if we slice and dice our non-metropolitan counties into these two groups, you can see that in the 2000s, the micropolitans, so they have that slightly larger core and can have a more, say, of an employment center to them. Those grew about 4.5% in the 2000s, but only about 1.5% last decade. And you can see for the non-micropolitan, I apologize for the language. We need better language in calling things like non and not in comparison to other counties. The non-micropolitan counties only grew about 2% in the 2000s, but did grow a decent amount, 1.7% in the 2010s. So another way we can divide up the non-metropolitan counties of the state is whether or not they're adjacent to metro areas. And, kind of a hard thing about working with rural or non-metropolitan data over time is that it's much more common for non-metropolitan counties as they grow to become part of a metropolitan area. Well, then their population just drops out of the, the side of the equation for non-metros. So when you have to be a little careful when you look at statistics where people say the rural population of the country is dropping, because a lot of it just depends on the change of definition of counties, and particularly the ones that are on the edges of existing metro areas. But as you can see from this chart, the non-metro counties that are adjacent to metros, they grew about 4% in the 2000s, and their growth slowed down though quite a bit in the 2010s. It dropped down to 1.4%. For those non-metro counties that are not adjacent to metros, and sometimes we call these sort of like remote counties, it might be a better term to use for them. They're furthest away from a metropolitan area. You can see actually in the 2000s, as a group, they did lose some population, close to 2%. They had a bit of a rebound in the, in the 2010s. And I'll talk more about how there was some of the reasons that might be behind a little bit of that rebound in the last decade. All right, population by age. And again, as I mentioned, we really don't have a lot of detailed data right now, but we can at least say a few things about the youth population in the state. Let me go on to my first slide here. So for the young population in the state, it increased about 6% in the 1990s, but then it started decreasing. It decreased about 2% in the 2000s, and then another 4% in the latest decade, the 2010s. And so as a share, young people in the state, always used to be pretty consistent that we could say 1 out of 4 Wisconsin residents was under the age of 18. And now it's getting down close to 1 out of 5. So that's quite a change. So what's been going on here? Well, the big thing, Steve mentioned the Great Recession and its impact on certainly on employment in metro versus non-metro areas. What's happened since the start of the Great Recession is what I call the birth dearth. They're just from our last peak year of births, which was 2007, the year just before the recession hit with full force. We've seen a 17% decline in annual births. And Wisconsin's experience, it follows the national pattern very closely. I think nationally it's like 17 or 18% fewer births now than there were in 2007. So anyway, if births had remained over this 13, 14-year period at roughly the same levels as at the start of the Great Recession, we would have 67,000 additional youngsters in the population, and those simply aren't there because of the change in the birth patterns. So if we look at our young population, again, by metro and non-metro areas, you can see here over in the left part of the graph in metropolitan counties, it fell slightly. The number of young people fell about 2% in the 2000s, about 4% in the 2010s. Now, the non-metro counties was far more pronounced in percentage term and in across the 2 decades than in the metro areas. And in the chart on the upper right here, I sort of summarized, okay, what's been happening over the last 20 years. You can see in metro areas, it's only fallen about 4%, but in non-metro counties, the youth population is about 12 to 13% less than it was in the year 2000. So that's a substantial difference between counties, whether they're in a metropolitan area or not. And then if we look just at those counties, what I call the remote counties that I described earlier, the ones that are not, non-metro counties, they're not adjacent to metro areas at all, their number of children are down 22%. So that's like 1 out of 5 fewer children in the year 2020 than there were in the year 2000 in those particular counties. So I've talked a little bit about some of the what we call the components of population change. So I'll take a minute here, just time to just describe some basic applied demography 101. So you get a 1-minute lesson or so in what we look at when we're looking at population change. And again, at this point, as I mentioned, we don't have a lot of detailed data from the 2020 census, so we can't get into the real nitty-gritty of migration by age groups like the elderly or working adults or things like that. So but anyway, sort of the general formula for us is that births add to the population and deaths obviously subtract from the population, and so the difference between those two amount to what we call natural increase. So now this can your deaths can exceed births, as I think Steve alluded to, and that's a situation called natural decrease. The other component, big component, population change, is in and out migration. And again, you can note that this can be a negative number as well as a positive number. So by summing these two pieces together, those come out to equal the population change over a period of time in a particular geography. I already did show, the decline in births as it was happening since 2007. Here I've added in now the deaths, which have been rising gradually from 2007 up to 2019. And the green bars at the bottom, those illustrate the difference between those two, the natural increase. So back in 2007, you can see we had close to a natural increase, people being added to the population of nearly 27,000. And you can see that fell pretty steadily through the 2010s, fell for the first time below 10,000 in the year 2019. And then with COVID in calendar year 2020, we actually did have more deaths than births that year. So it's the first year since the state's been keeping records, which stretch back to 1905. It's the first year where the state has been in a position of natural decrease. And obviously 2021 and 2022, with the pandemic still going on, doesn't bode well for Wisconsin to return to a position of natural increase. And again, states are in exactly the same situation as us. With other of the last decade. So in the next couple of graphs, I'll be talking about just the difference between censuses and how much can be attributed to natural increase and how much to net migration. As you can see here with these graphs, again, this is just statewide data to start with, that natural increase held pretty steady across the 1990s and 2000s, but then did have quite a drop in the 2010s, about a 40% drop. Somewhat similarly, net migration back in the 1990s, it constituted almost half of the state's gain during that decade. And then, as you can see, it tapered off in the 2000s and even more so in the 2010s. So now it's only about a quarter of what it was in the 1990s, and it's only accounting for about a quarter of the population change. So Wisconsin, and again, we have plenty of company with other states. We're stuck kind of in this demographic double squeeze situation where our natural increase numbers are falling, continuing to fall. You know, once we get past the pandemic, still there won't be a lot of gain in the population due to natural increase. So that increases the pressure on increasing the migration to the state, and just the recent experience is not pointing to a substantial gain in migration, but we'll have to see. So then if we just look at the these components of change here by metropolitan and non-metropolitan status. Again, you can see in metro areas, natural increase, that's the graph on the left. It fell about 30% from the 2000s to the 2010s, and net migration fell about 45%. Now in the non-metro counties, you can see natural increase was positive in the 2000s, but that actually slipped into a position of natural decrease. The deaths during the past decade in non-metro counties exceeded the number of births slightly. And actually about 29 of the state's 45 non-metro counties experienced natural decrease during the 2010s. You can see actually that net migration increased slightly in the non-metropolitan counties here.
3 minutes left, David.
Oh, okay, thanks. Be able to get through. So yeah, so and again, so taking our non-metro counties and breaking them down by adjacency and non-adjacency. I'll focus because of time on with the graph on the right. Again, you've got natural increase in these what I'll call very remote counties, increased from the 2000s to 2010s. But the net migration, as you can see, really jumped quite a bit. It was actually negative during the 2000s, but actually it's positive 11,400 this last decade. And what we saw is, people remember probably all too well, with the Great Recession, it really hammered the housing market. And what we found through research is that basically people were frozen in place at the end of the decade, that people who say lived in metro areas and maybe were planning to retire or move up north to the house they might have had seasonally and were planning to convert it to year round. People couldn't sell their houses in the metro areas, so they didn't move up north. There was still some drainage away because of the financial situation from non-metro counties. And so it appears, and again, once we get more detailed age data, we'll be able to tell better. It seems like a return to sort of that historic pattern of positive net migration to some of the state's more remote counties. All right, to conclude here, I just want to touch on race and Hispanic origin a little bit. And if people have watched Henry Louis Gates's program on PBS, he recently had this illustration that was came from Mexico, the Spanish colonists in Mexico apparently developed this system of like 16 different, we call them races, they call them castes in this case, in a way to identify people based on the color of their skin. And, you know, the US has had its own convoluted history with race and Hispanic origin. I don't expect you to be able to read this, as it's kind of a mind-numbing chart of how race and ethnicity definitions have changed from the 1790 census forward. Now, what happened in 2020 is very interesting. The Census Bureau made substantial changes in tabulating the race and Hispanic origin responses for 2020. Their electronic capture of people's written in answers under the race and ethnicity questions went up to 200 characters, whereas at 2010, they only captured the first 30 characters. And then they made additional modifications in the prioritization schemes, the race Hispanic origin code lists, and actually recording up to 6 detailed codes rather than just 2, which they did in 2010. And it's kind of like we weren't sort of aware of this, how much of a substantial change was coming along until the data came out. And so here's just a capture I've done, an analysis I've done of within the Hispanic origin population, what racial identification was given in 2010 versus 2020. And you can see the numbers highlighted in red are particularly large changes, and see people who are Hispanic, who said they were white alone, dropped by like 14 million. And again, American Indian, Alaskan Native identified as a race jumped quite a bit. Some other race and 2 or more other races also increased a lot. So, I mean, we could say the identification of race has been a perpetual problem since 1790, but it's having a real impact on our ability to look backwards. So I'm basically, I'm not making any backward comparisons of race and Hispanic origin, and I recommend that you avoid them as well if you're dealing with data in particular areas. What you are able to say is, you can compare within the 2020 data. For example, here in this graph, children compared to adults, and you can see some of the differences in race and ethnicity identification. Hispanic, Latino, the percent of children who identify as Hispanic and Latino is about twice what that percentage is among adults. And you see other percentages here as well. So that I've thrown a lot of numbers at you here and a lot of graphs. Hopefully no one's been impaled by some of these numbers that I've thrown out here, but it sounds like everything will be recorded, and maybe the graphs and so forth will be available later, so people can look at them more thoroughly. So thanks.
Perfect. Yes, thank you, David. And we will be putting both the recording and PowerPoint presentations for people to access. So thanks again, David. Next up is Mattcuris. Matt is Community Economic Development Specialist with the University of Wisconsin-Madison Division of Extension. Matt has extensive experience working with communities and organizations across the state in the areas of regional economic analysis, labor force research, socioeconomic impact analysis, and industry sector competitiveness. And today, Matt will discuss labor force trends in rural Wisconsin. Matt, the floor is yours.
Great. Thank you, Brandon. Can everyone hear me okay and see my slides? Just a thumbs up. All right. Thank you. First of all, I want to thank Steve and David for setting the table so well for me. They're discussed a number of trends that I will go into a little bit different perspective to look at how they influence labor force availability in the state of Wisconsin, as well as more specifically in rural Wisconsin. And unfortunately, I'm going to continue the number explosion a little bit here. So if you do have questions, please feel free to put them in the chat, and I'll try and answer them best that I can. I'm also going to use non-metropolitan counties as a way of looking at rural Wisconsin, and just again to build upon what David and Steve just talked about. The counties you see in red there are the metropolitan counties in the state, and those in tan and gray are the non-metropolitan counties. So again, I'll be focusing primarily on the differences between those geographies, but I'll also put some perspective on what the entire country looks like in terms of some of these trends we're seeing in terms of labor force as well. So, I got a little ahead of myself here. One of the things we hear a lot about now is the number of job openings in the state of Wisconsin. And what this looks at is trends in job openings going back to 2001. And indeed, we do see that there are historic highs in terms of the number of job openings that we currently see in the state of Wisconsin. They really peaked last fall, and we've seen them come down a little bit now, but compared to prior periods, we are significantly higher than we have been in terms of total number of job openings. I will say this though, if we look at the period prior to the start of the pandemic, back into 2018, 2019, job openings then were even historically high compared to the prior periods as well. So as Steve talked about earlier, this is not something that just started overnight due to the pandemic, and is really part of structural factors we see in the state of Wisconsin. And certainly part of this has been what a lot of people have called the Great Resignation, the number of people that have quit their job. And we see that quits are very high. But again, in some ways, this is not really surprising because when the economy is doing well and when the job market is very strong, people are more confident and they are willing to quit their job for other opportunities. Now, what's driving a lot of these trends that we're seeing? When we think about labor availability, not just in rural Wisconsin, but in any geography, we can think about a number of different measures that help us understand what's going on in the labor market. First of all, we can think about unemployment rates, or the share of the labor force that is unemployed and, importantly, actively looking for a job. And unemployment rates, importantly, also vary by geography, by time period, by occupation, by age, and other characteristics of workers. So just because we see an unemployment rate for a given geography at a given time does not mean that it extends to every single individual living in that geography. And it does not mean that that the geography has seen the same rates across different economic periods. We can also think about what are called labor participation rates, and that's the share of the population that is either employed or unemployed and actively looking for a job. And we can also think about different factors that influence labor participation, and those can include things like childcare. I saw childcare come up a little bit in the chat box just earlier. If people have a hard time finding childcare or they have other dependent care needs, they're going to have a hard time perhaps entering and staying in the labor force. We might see weak demand for labor that leads people to drop out of the labor force because they simply are discouraged. They don't have the skills, or the overall economy is not doing well, so they stop looking for a job. Transportation, if you can't get to a job, how do you stay in the labor force? School enrollment, justice system involvement, disability, retirement. These are all different individual characteristics that may push people out of the labor force or help them stay in the labor force based on where they are in their life stage. The working age population. David talked a little bit about trends in terms of the number of individuals under the age of 18, as well as individuals over the age of 18. And I'll provide a little more perspective on what those different age groups might mean in terms of labor availability. And then finally, geographic extent of the labor market. How far are workers willing to commute? So first, let's start looking at unemployment rates. And these are all non-metro and metro counties in the state of Wisconsin compared to the United States unemployment rate month by month. And these are seasonally unadjusted, so they're not adjusted for any sort of seasonal trends in the labor market, things like tourism, things like the holiday season, and so on and so forth. But nonetheless, what you see here in Wisconsin metro counties and non-metro counties is that we are at historic lows in most places for our unemployment rate. We can also see that both non-metro counties as a whole, on average, as well as metro counties are below the US average unemployment rate. And importantly, if we think about the number of unemployed individuals per job opening, we are also at historic lows. We can see that there are about 2.4 jobs per unemployed individual in the state of Wisconsin right now, or about 0.4 unemployed individuals per job opening, also at historic lows. But again, this is not just due to the pandemic and people staying out of the labor force. We can see that prior to the onset of the pandemic, we were also at historic lows compared to the prior 2 decades in terms of unemployment rates and job openings. If we think about unemployment rates by non-metro county, we can also look at the 45 non-metro counties in the state of Wisconsin and how they compare to state and national averages. We can see that for the most part, most non-metro counties in the state of Wisconsin are below the unemployment rate for the United States. Some of them are a bit higher than the overall statewide average. But for the most part, most Wisconsin counties are below 3.5% unemployment rate. And a lot of labor force economists would argue that that unemployment rate, we are at full employment, or that everyone in the labor force who wants a job has a job. If we look at how we stack up nationally in terms of our unemployment rate in Wisconsin counties compared to neighboring states, you can see for the most part in both metro and non-metro counties, our unemployment rates are below many of our counties in neighboring states, as well as many counties throughout Western and Southern United States as well. Now, labor force participation and its trends over time is something that a lot of people have have talked about in terms of labor availability. And one of the things that you will see in the state of Wisconsin for the participation rates of individuals age 16 and over is that they have traditionally been higher than the US average. And they have also come down, much like the United States average, since the late 1990s. We see an overall participation rate of about 75% in 1998. And we have since dropped down to about 65.5% in the United States, or in the state of Wisconsin, which nonetheless still remains above the US average. Now, what are some of the factors driving these changes in unemployment or participation rates, and what does that mean for the future of labor availability in the state of Wisconsin? First of all, we have to think about how participation rates vary by different age groups. And these are comparing individuals age 16 to 19 in the state of Wisconsin to the United States over time, as well as individuals age 20 to 24. And here again, we see that participation rates for these different age groups in the state of Wisconsin are higher than the national average. But we do see that they've come down a bit over time. And we also see that they tend to be a bit lower in terms of age 16 to 19 than the overall average, and a bit higher for individuals age 20 to 24 than the overall unemployment or participation rate for the state of Wisconsin. Now, one age group to keep in mind on is what's known as the prime working age population, and that's individuals age 25 to 54, and that's when individuals are most likely to be in the labor force. And again, here, if we split this down across differences in the United States compared to the state of Wisconsin for both men and women, we can see again that participation rates in the state of Wisconsin for both men and women are higher than the national average. But we also see that they have come down a bit since the early 2000s, 94.0% for state of Wisconsin men in 2000, down to about 91.1% annual average in the year 2020. And similar declines in the United States, as well as declines among women as well. We can also see participation rates for individuals nearing retirement age, individuals age 55 to 64. They are quite a bit lower than the prime working age participation rate, and also participation rates for individuals age 65 and older. And that's where participation in the labor force drops dramatically. So down to about 20% of individuals age 65 and over in the state of Wisconsin. So what happens then, given these participation rates and how they perhaps changed a bit over time, but also thinking about the share of our population and how it's changed over time among these different age groups? We can see that between 2000 and 2018, individuals age 55 to 64 increased by about 80% in the state of Wisconsin. Individuals age 65 and older increased by about 40% in the state of Wisconsin. Individuals age 20 to 24 increased a little bit, about 10%, but we can also see prime working age population, age 25 to 54, was essentially flat. And if we take those participation rates among those different age groups and also think about how those age groups have changed over time, and we use a technique known as shift share analysis, the decline in the state's overall participation rate is almost entirely explained by the changing age structure that we have in the state of Wisconsin. Now, that said, declines in participation among males aged 25 to 54 are a factor in the decline in our overall participation rate as well. So something to keep in mind moving forward. So if we look at prime working age population and how that's changed over time, or excuse me, and how it's distributed among our non-metro counties in the state of Wisconsin, you can see for the most part, our male prime working age individuals are somewhat higher than the national average. Now, that said, these participation rates come from the American Community Survey, which do have some large margins of error in some instances. So if we look at the national average or the national distribution of prime working age males and just simply look at those that are statistically higher or lower than the national average, we do see for the most part that many Wisconsin non-metropolitan counties are either similar to the national average or are statistically higher than the national average as well. We do see several counties that are significantly lower than the national average, and many of those counties are places that include a correctional facility, which does depress the labor participation rate because those individuals are included in the numbers. We do it for women. We can also see that most non-metropolitan Wisconsin counties have a prime female participation rate above the national average. And again, if we compare it to the distribution nationally, we see many Wisconsin counties tend to have high participation rates relative to other parts of the nation. And again, many of them are statistically higher than the national average as well. So let's think a little bit more about this. We hear a lot about trying to increase participation rates among prime working age individuals. And I think that that's an important strategy for a lot of places. But what would it actually mean in terms of numbers of the labor force? So if we look at non-metropolitan labor force participation rates for individuals of prime working age from 2006 to 2010, we see that the participation rate was 86.3%. It dropped a little bit from 2015 to 2019, but not on a statistical significant basis. And if we apply those participation rates to the size of the working age population, the prime working age population, we can see that in 2010, there were 493,000 people in non-metropolitan counties that were in the labor force. If we apply the number of individuals of prime working age and the participation rate for those individuals in 2010 using 2010 estimates, we can see that, yeah, it dropped significantly. There's about 70,000 fewer people in the labor force in 2020 than there were in 2010. But what if we boosted that participation rate for individuals going forward? Let's say 5%, we brought it up to 90%, which is a very high participation rate. That would increase the number of individuals in the labor force by about 25,000 individuals. But we can also see that even with that increase in participation rates in 2020, we still have fewer people than we had in 2010 based on the participation rates a decade ago. And again, a lot of that has to do simply with the number of individuals of prime working age in the state of Wisconsin. And here we can see these projected changes, or excuse me, these estimated changes over time, going back to 1970. And I'm using 2020 estimates from the Census Bureau's estimates program. So these are not from the 2020 census, but just included here just to give you some perspective on how these might change over time. We can certainly adjust these once we get official census estimates. But one of the things you see is that the prime working age and total working age individuals really peaked in about 2020 for prime working age individuals and in 2010 for total working age individuals, and has since declined somewhat. We can see that across Wisconsin counties, and again, these are using estimates, these are not official population figures from the 2020 census. If we look at total working age population or individuals aged 15 to 64, we can see that there are only 8 Wisconsin counties that grew in terms of total working age population. And in terms of prime working age population, we only see 2 Wisconsin counties that grew on a percentage basis, Eau Claire and Dane. As Steve alluded to earlier, this is not something that's going to go away. If we look at the share of individuals age 55 and older in metro and non-metro counties that are employed in one industry or another, we can see that throughout the 1990s, it hovered around 11 or 12%. It was a little bit higher in the non-metro counties than the metro counties. But once the boomers started entering the older age cohort, we can see that the share of individuals age 55 and older that are employed in all industries in the state of Wisconsin started to grow. And we can see that the gap between non-metro and metro counties has also increased as well. And we can also see that of all employees age 55 or older or approaching retirement age, maybe in the next decade or so, we are now at about 28% of total employment compared to around 12% in 1990. We can also break this down on a county by county basis. The share of employees age 55 or older is a share of total employment going back to the second quarter of 2000, stepping up to the second quarter of 2021. And we can see that most counties have increased significantly in the share of their total employment accounted for by individuals age 55 and older. This is not the same by each industry. Again, we're looking at the share of individuals age 55 and older in the second quarter of 2021 by different industry sectors. We can see across all industry sectors, it was about 28% in non-metro counties. But we also see other large industries in terms of total employment that have higher shares of individuals age 55 or older. So we see manufacturing, which is a large industry sector in non-metro counties, at about 28% 28% or 28.7%, excuse me. Wholesale trade, public administration, educational services, also above the non-metro average. So again, these are individuals that are not yet retired, but are approaching retirement age. And as these people do drop out of the labor force, or perhaps drop some or don't work quite as much, it's going to continue to impact labor availability going forward. The last thing I want to talk about real briefly is how people choose to live in one place and work in another, or what their commuting pattern might look like. And David alluded to the fact that after the Great Recession, a lot of people were frozen in place. They couldn't sell their house and move to another area, or perhaps they were stuck in a labor market where they had to make decisions based on perhaps a spouse or another dependent care provider that did not allow them to perhaps change jobs or to move to another area.
3 minutes left, Matt.
Thank you. And here we can see the intricate networks of people commuting out of non-metropolitan counties to other places throughout the upper Midwest. And the share of individuals crossing county boundaries from their place of residence to their place of employment has increased somewhat over time, and has increased somewhat even more so in non-metro counties compared to metropolitan counties. And we can see that in 2018, about 56% of people who were employed and lived in a non-metro county crossed county boundaries for their place of employment. And in some instances, these were incredibly long distances. People were traveling 50 miles or more from their tract of residence, census tract of residence, to their place of employment. And we can see that many of these areas that have high shares are in non-metropolitan areas. Now, one of the things we could think about is job accessibility. Originally, we could think about this in terms of spatial mismatch, which was really thinking about job decentralization and housing segregation among central city residents that led to higher employment among those individuals, particularly among people of color. But since then, a lot of researchers have looked at how this concept might extend to not just central city areas, but also to non-metropolitan areas as well. And there's a lot of different measures to look at the number of jobs that might be available relative to the number of employees that might be in an area as well. So we're using a measure here known as reveal accessibility. So we're looking at the ratio of jobs to workers available within a given distance, and we can further segment this by different income levels, by different industries, by different race and ethnicity, and so on and so forth. So in this instance, we're looking at a given geography in central Wisconsin. What are the number of employed individuals within a given radius, and then comparing that to the number of jobs that are available in a given radius as well. And if we do this for all census blocks in the state of Wisconsin, and then just simply aggregate it up to census tracts just for visualization purposes, we can see that there are fewer jobs per employee available in many non-metropolitan areas compared to our metropolitan areas. We can also see places that are central employment locations in non-metropolitan areas as well that do draw a lot of people from surrounding areas. But there is a bit of a mismatch in terms of the number of jobs available relative to the number of workers available in many non-metropolitan counties. If we go out 30 miles, we can see that it kind of comes together a little bit more. The differences aren't quite as stark. And if we go out to 50 miles, we see that the differences are again approaching what we call parity, that the number of workers per job is close to 1. But if we do this for the entire state of Wisconsin and aggregate it up in terms of what's the ratio of jobs to workers at different distances in non-metro and metro counties, we can see that for distances, commuting distances of 10 miles, 20 miles, 30 miles, and even up to 40 miles, there are a surplus of jobs for metropolitan workers and a deficit of jobs for non-metropolitan workers, which forces a lot of those individuals to commute, and in some instances, again, long distances. If we break it down in terms of metro high earning jobs versus low earning jobs, and non-metro high earning jobs and non-metro low earning jobs, we can see that there's not a lot of difference in terms of accessibility to low earning jobs in metro compared to non-metro areas. But there is a stark difference in compared to the number of high earnings jobs that are closer in accessibility to metropolitan residents than non-metropolitan residents. And not surprisingly, one of the reasons for that is that many jobs in metropolitan areas on average do tend to have higher levels of compensation. This looks at average compensation for all jobs in metropolitan areas compared to non-metropolitan areas. And we can see that there is a pretty large bit of difference. If we look at other industries like manufacturing, we can see that the difference is even larger in many places. So we can see that it makes sense for people perhaps live in a low cost of living area and commute into a place where you get a higher average wage and then are able to take that home to your residence community. So as you think about this, when you think about what you may be trying to do in terms of your community, in terms of attracting workers and keeping workers, think about the types of housing you have available. What are the characteristics of those housing choices? If you're an employer, are you an employer of choice? Do you have the ability to build social networks to help keep people at your job, at your place of employment, or in your community? And then all these other quality of life characteristics that might be important for individuals. How do you make sure that you have those available to workers in your community in terms of getting them to have move to your community or perhaps stay in your community instead of making these long commutes? With that, my contact information is available there, and I will turn it back over to Kristen.
Great, and thank you, Matt. And there are some questions. We're going to keep going though. So Matt, if you can answer some of those, otherwise we will try to pull in some of these questions a little bit later. So next up is Molly Pyle. We are very excited. Molly is from out of the state of Wisconsin. Molly is an entrepreneurial ecosystem development lead with the Center on Rural Innovation, which is located in Vermont. Molly supports rural communities as they develop and grow strong entrepreneurial ecosystems, creating scalable tech startups in rural America. Prior to joining Corey for short, she worked with social impact startups at MIT Solve and worked with international women leaders in STEM and entrepreneurship with the State Department and led incubator and accelerator programs with Singularity University. Today, Molly will be sharing her work with tech entrepreneurship in rural America and will explore the external barriers that prevent rural communities from supporting and developing tech entrepreneurs, as well as some strategies for overcoming these barriers. So Molly, the floor is yours.
Thank you so much. And hello, everyone. As mentioned, I'm Molly Pyle. I lead the work on entrepreneur ecosystem development at the Center on Rural Innovation. And I could not be more thrilled to be here with you today to discuss tech entrepreneurship in rural America. So I work with rural entrepreneurs and ecosystem builders every single day in my role here at Corey, or at the Center on Rural Innovation. We are a national nonprofit that is focused on advancing inclusive rural prosperity through digital economy ecosystems that support scalable tech entrepreneurship and tech job creation. And I'll go into a little bit more about what we mean by that and how. And why we focus on this specifically. It's because the United States is currently facing the largest rural opportunity gap in history. And this was in part due to after the Great Recession in 2008, rural economies frankly never recovered, whereas metro counties bounced back and continued to grow jobs. Until, of course, COVID-19 hit, and you can see here it's had a significant impact no matter where you live, but it has pushed rural communities even further behind. And this graph here demonstrates that difference between urban and rural areas. And the darker green line represents urban, which have always been ahead of rural, the green line here, but you can see the extreme dip that COVID has caused. And in employment particularly, thus creating this most significant employment and opportunity gap. And closing that gap and really addressing that is precisely why the Center on Rural Innovation exists. And when we question how this rural opportunity gap happened, we generally focus on three main causes. And some of this has been discussed by other presenters today, so should be no surprise to anyone in the room. But the first is automation of manufacturing jobs, which historically have been a huge part of rural employment. Between 2001 and 2015, manufacturing employment fell by 30%, and manufacturing employment was twice as high in rural areas as in urban areas. The second cause we look at is globalization. The outsourcing of manufacturing and digital jobs to other countries has deeply contributed to the decline in manufacturing employment in rural America. And then the third cause, which I'll focus a little bit more specifically on as my work here centers entrepreneurship, is this decline in entrepreneurship that's been going on now for several decades and is compounded by the lack of investment that goes into startups in rural areas. And like I mentioned, that decline in entrepreneurship in rural areas is validated through historical data showing in 1977, 2 out of 10 startups in the United States were based in rural areas, and that number has dropped down to just 1 in 10 now. And we have to ask why, right? Why is it that there's such a gap in tech entrepreneurship specifically between rural and metro areas? There's a number of external barriers that prevent rural people from becoming entrepreneurs. And one of those main ones is a lack of access to dedicated programs, educational and training programs, such as incubator programs and accelerators that can help people not only believe that this journey is possible, but also find the places to access that opportunity for them. Another is the lack of access to the people, the experts, the mentors who have been there and done that and could provide critical support and critical guidance and encouragement to tech entrepreneurs and startup founders. Once a rural area has these things, they have some infrastructure in terms of education programs, mentors, and experts. They have the beginning of an ecosystem that can really support the creation of tech startups that would be attractive to investors. But then the issue of lack of access to capital can appear. We know that it's particularly challenging in rural areas as less than 1% of all venture capital money goes to rural areas, and 80% of all venture capital investments go to just 5 major metro cities, 80% of all of the investments, 5 cities. And then of course, in order to grow and scale startups, in addition to capital, you need tech talent. You need folks who can build the products and services that you're selling. And that can be a major barrier in rural areas, as 39%, and I suspect it's even greater, of tech entrepreneurs in rural areas have reported they could not find candidates with the right kind of expertise. And 37% said that their communities lacked the adequate talent pool that was necessary for them to scale their tech startup, which of course leads to them leaving that community, going elsewhere, going to one of those 5 major metro hubs, for example. And these are all very formidable external barriers. And I think they can further be compounded when you think about some of the internal barriers faced by rural people as well, which are wide ranging, but can include a mindset that is less open to taking risks due to a lack of representation and amplification, not seeing a successful entrepreneur from the community you're from or from the region. It's a continuation of this problem that's known as this "you can't be what you can't see" phenomenon, a general lack of awareness that people are doing this, that this is possible, and that there are opportunities in scalable tech entrepreneurship and there are support systems available. That is really critical. And also the lack of scalable tech startup ideas, or how a small business idea could actually be pivoted and transformed into a scalable tech startup. All of these things are possible, but they take trusted mentors, coaches, and educators who can help a community realize these opportunities. Of course, we believe in the possibility of doing this and of bridging this gap. And we work with rural ecosystem builders across the country every day who are doing this work, and it gets closer and closer to really becoming the reality. We know that a shift is starting to occur across the country. People are waking up to the possibility that tech entrepreneurship truly can succeed anywhere, that it's possible for small places to be home to huge ideas. We simply need to build the ecosystems and those support structures that can encourage and scale those ideas. And building those ecosystems and those support structures, of course, takes funding, which is why one of our focuses as an organization is to help rural communities and rural leaders that we work with apply for federal funding opportunities, such as the Economic Development Administration's highly competitive Build to Scale Venture Challenge grant. It's formerly called the I-6. And we've been helping communities apply for this grant. And through that work, we have helped rural communities win more than $18.5 million in federal funding to do this work and build their scalable tech startup ecosystems. And I'm very proud to say that one such community that we've helped to win this grant is based right here in Wisconsin, and that is Platteville. And I'll tell you a little bit more about what Platteville is up to later. But based on our experience and really what roots this model and working with communities like Platteville and so many others across the country is what we call the 5 drivers of digital economic development. And these are the things that we found really support tech-based economic development and rural entrepreneurship. And they're underpinned by what we call the foundational elements, things such as housing, quality K-12 education, and then necessary infrastructure such as broadband, local leadership capacity, and spaces for entrepreneurs and the community to meet and to gather. These are all really vital in order for community to then be prepared to work on these 5 drivers that really can progress towards digital economic development, which ultimately really maps back to these outcomes of local wealth creation by startups and creating quality digital employment. So with these foundational elements in place and with these infrastructure pieces in place, we really help rural communities focus on these 5 drivers. And my main focus today and what I do in my work is dig into the scalable tech entrepreneurship support and incubation that's available in a community. How can we have fast growing startups root in a rural community as opposed to focusing on attracting companies from other jurisdictions or retaining existing companies? Although those can be perfectly fine and important initial steps to develop a startup community, we want to think about how we can create a local economy that's able to continuously foster new startups, help launch new ventures. And these successful startups start to emerge and accelerate the economic development of a community as they create this sort of positive feedback loop. They have founders who are then becoming mentors, who are encouraging other folks to go out and try this. And they're really building these high impact businesses along with wealth and employment. And in addition to this time, their success inspires the broader community again and future generations by showing that this is possible. And why we focus on this is there really aren't that many support structures out there to help build scalable tech startups and support tech entrepreneurs in rural America. We found that support on this driver leads to the creation of more innovation, more jobs, and ultimately more wealth owned at the local community level. And of course, this is just one of 5. So these other 4 drivers really connect back to this. Of course, one major one being access to capital. How can we ensure that there are financial support structures in place for startups and for emerging companies? So that can include sources like angel investor networks and even the use of public funds to leverage private investment funding. Others include access to digital jobs, which is often created through startups and new demand for tech workers. And then digital workforce development, which ensures that there's an availability of a really technically skilled workforce. And that can encourage other future generations, again, starting all the way at K-12 to go into this, to look into this and create internship opportunities, create other technical training opportunities, really ensuring that there's lots of different angles in the ecosystem to fill out a pipeline of future workforce staffers to then join these startups. And underpinning all of this, a really important thing is to think about the strength of the inclusion in the community. How is this tech culture really emanating and opening up to many different folks who may not have otherwise thought this was possible before? Can different people participate in the digital economy than the masses that you often think about when you think about Silicon Valley, right? So how can you make your tech culture really inclusive? Are you focusing on bringing in underrepresented groups, targeting outreach in different and unique community locations, and just really bringing in the different folks from your region to represent the full demographics that you have? So as mentioned, Platteville, Wisconsin is one of the communities that we've worked with to implement this model, and they are joined by 25 other rural communities that belong to what we call the Rural Innovation Network, which is a community of practice of rural ecosystem builders spanning 19 states, 4 time zones, and overall covering a population of 1.8 million people. We're really proud to work with these rural ecosystem builders and leaders, and ultimately what we do is support their vision for what they believe needs to happen in their community to build a digital economy. And we work with these leaders to really build those strategies, right? And fund the programs and services that are vital to supporting an innovation economy and entrepreneurship, or more specifically, as I've mentioned, scalable tech entrepreneurship. And as stated, we have that specific focus on helping communities create scalable tech startups, which is different than a traditional focus on small business entrepreneurship. And to be clear, we really love local small businesses, shop local, buy local movements, and we believe that small businesses are essential to any economy and should be valued and supported as such. However, we support rural community leaders to specifically focus on scalable tech startups rather than small business support, because there are lots of other organizations and entities out there, such as the SBDC, CFED, Axiom, SCORE, Co-Starters, just to name a few, that can support small business entrepreneurship. But there are less support structures out there that are accessible to help rural community leaders build scalable tech startups and scalable tech startup communities in rural America. And that is critical as we view to the digital economy ecosystem model. We believe creating those tech startups is what drives greater numbers of jobs and ultimately wealth and ownership to a rural community. So we help think about, for rural leaders, who is a scalable tech entrepreneur? Is it someone they know? Can they picture this person? Can they find this person in their community? We help them understand that it's someone who is using a startup to search for a scalable and repeatable business model that they could turn into this high growth, profitable company. And they often do this through entering a large market, often with external risk capital. And their goal is maybe an exit or an acquisition or building some kind of valuable IP. We differentiate this between a small business entrepreneur who generally doesn't have those same goals. And we underpin it by saying the rise in popularity and efficacy of distributed teams and remote work makes it easier than ever for scalable tech startups to be built and scaled outside of metropolitan areas. And here's an example of that. I want to tell you the story of a real person named Marcus, who lives in Wilson, North Carolina, a rural community. And he had spent years working in the automotive industry, dealing directly with customers and processing problems at the dealership that he worked at. He realized that he could use a software of some kind to fix some of the problems that continued to arise between customer engagement and processes in the repair shop. But since Marcus is not a software developer, he posted about this idea on Facebook. And he asked, do I know anyone who's a software developer? I feel like there's something that could be built here. And a previous client of his actually reached out, who was a software developer, and helped him build the product. So in 2018, Marcus and his then co-founder started on this project. And in 2020, after they had a model of the product and piloted it for a while in the auto shop where Marcus worked, Marcus had other dealerships start to call him and ask to use the software in their shops. The word of mouth started getting around that this was really effective and that customers were loving it. So at this point, he recognized the true potential of this innovation and product, and he applied to Wilson, North Carolina's Riot Accelerator program, offered at their local co-working space. So he and his co-founder, that previous client who helped him build the software, left their jobs full-time to pursue this company, which they named Shift Auto. The differences between an auto repair business and a company that sells software to auto shops are pretty clear, right? The ability to create products that are no touch and power connections between potentially limitless numbers of people or limitless transactions is what makes this truly scalable and what makes this business model and use of technology so effective. And we like to say that building this kind of tech, in this case, a software product, requires a sort of wide and advanced range of skills, which brings the demand for specialized talent. Marcus was lucky enough to find this by asking on Facebook, but we like to say it's really important to note we focus on this as well, connected to entrepreneurship, so you can ensure there are pipelines of both tech talent and entrepreneurs working as close in lockstep as possible. Focusing ultimately on creating tech entrepreneurs and the tech talent that they might need to support them later on is how we can help rural places in an age of accelerating automation ensure that they're creating some of this ownership of production and they're not going to be left behind. We've seen many other examples of these kinds of scalable tech startups being built and putting down permanent roots in our network of rural communities. Just to name a few, we've seen Pluralsight, a data skill building and development process flow service, come out of rural Durango, Colorado, and Yoast Labs, a virtual reality hardware and software development company based in rural Portsmouth, Ohio. These are just some examples of the wide range of things we're seeing coming out of rural communities in terms of true scalable tech startups that are staying rooted and planted right there in the rural community where they started. So how can a rural community really do this? How can they support people to become tech entrepreneurs and to stay where they are and grow in that company and hire more local folks? What we have really identified as needed is a pathway or a journey for them to take, starting from the very beginning stage where a person may not yet even have an idea for a startup, but knows that maybe they'd like to start a company or do that one day, all the way to the very final stage where they've successfully launched and grown and scaled a company and hired locally and created wealth in the community. So to illustrate this, we have a model that outlines the phases of development for a community to support local entrepreneurs along their journey, from what we call phase 0, the foundation stage, all the way up to, again, that growth stage and that final outcome where you have this really sustainable culture of ideation, launch, and scale. The most important thing to keep in mind is that this sequence of programming and activities that I'll show you is all about the entrepreneur and the journey. Creating really strong, compelling offerings at the earliest phases builds a better pipeline. So we can look at some examples I will show you throughout our Rural Innovation Network communities. First, we're going to look at what we see often at the phase 0, the foundation stage, where the focus is mostly, if not all, around small businesses, local Main Street movements. And it's great, there's an entrepreneurial spirit and we want to celebrate that. But what can often be created from there is this parallel path to start to get into tech startups and tech entrepreneurship from this first phase of the foundation. And here are some examples from our Rural Innovation Network of phase 0 programs. First, there's the Co-Starters cohort in Pikeville, Kentucky, which was a small business development cohort for aspiring women entrepreneurs throughout Appalachia, which was facilitated by 4 female entrepreneurs. Another example is a program called Gentreprenneurship in Pine Bluff, Arkansas, which provides lean startup support for local innovators and entrepreneurs at the really early idea stage with a focus on BIPOC founders. From there, with those kinds of assets and resources in place, you could start to move into and really create that parallel path, like I said, to support scalable tech entrepreneurship. And maybe that means that the idea of supporting tech startups is included in the community's SEDS or in the local economic development strategy, or it's becoming seen as, you know, a real priority within the community. Perhaps there's a key organization in the ecosystem that supports tech entrepreneurship and is building a brand and some kind of brand awareness around that. So community members know that there are resources for them that are focused on scalable tech startups, and allowing for that, you know, local aspiring entrepreneur to find a space, to find some media, to find some inspiration, to find education, and maybe even to find an idea for them to really get started in building out what that could look like. And some examples of this include a inspiring speaker series in Red Wing, Minnesota, which they put on all about local tech entrepreneurs and how they did what they did and how they can tell others that it truly is possible. Another example is the Startup Ada Boot Camp in rural Ada, Oklahoma, which is a boot camp that teaches small business owners and aspiring tech entrepreneurs some basic startup education fundamentals, and also provides an opportunity for small business entrepreneurs to start to bring in elements of technology. How might their product be more tech-enabled or even pivot to be truly scalable? And like I mentioned, then moving from there into phase 2, this is when a community is equipped to support the launch of tech entrepreneurship and tech startups fully. You've done the work at the foundation stage, you've helped people kind of move through working into ideas, and now they're ready to get started. They're ready to formalize ventures. They're ready to perhaps participate in a structured incubator or accelerator or pitch event program. They need some kind of resource like legal and financial help to actually formalize their company. Perhaps they need to find a mentor who can encourage them and keep them going when inevitably the journey gets rough. And like I mentioned, they need tech talent. They need folks to help them build out the products and services. Some examples
3 minutes,
of
Molly. I'm sorry, 3 minutes, Molly.
No problem. North Iowa, a rural region that has been working with MIT on a mentorship program to train local mentors to be excellent tech mentors for the aspiring founders. And also Shenandoah Valley, a rural region that has a hybrid incubator accelerator program to meet the wide-ranging needs of the entrepreneurs in the region. There's a number of other examples of this across our network, and one I think that is particularly notable is in Traverse City, Michigan, which has partnered with Arrowhead Incubator, a nonprofit that serves Native Americans. It's one of the few Native American focused economic business incubators, and that happens in 20 Fathoms, their co-working space. Finally, phase 3, the growth stage, where a community has fully enabled entrepreneurs to grow their startups with many local ventures actively scaling and receiving investment. We see this happening in some rural communities like Cape Girardeau, Missouri, who has a grant-based incentive program for startups to relocate there, as well as in Traverse City, like I mentioned, who has a really active angel network who has made multiple investments in homegrown companies there. So altogether, you can see how these assets and activities really build on each other to ultimately lead to the outcome of a thriving culture, an inclusive culture of scalable tech entrepreneurship, which is able to sustain and support the ideation, launch, and scale of new startups. These startups are receiving investment and hiring locally, and thus creating more jobs and wealth in the community. And this is the larger progression that's modeled on our experience working with rural startup communities. In practice, it's really important to recognize the uniqueness of each community and to understand that the tactics and strategies they deploy will always look a little bit different. As a principle, we work with communities to meet them where they are when co-developing their tech-based economic development strategies and help them leverage the real assets that they have to this end. So finally, a few more examples from communities who have all won the EDA Build to Scale Award to build out their startup and innovation ecosystem. You can see some communities have been awarded are at different stages of development. Like for example, phase 1 is Independence, Oregon, who has really worked hard on trying to transition their ecosystem from more small business and food trucks, for example, and an industrial kitchen they have, into more scalable tech. An example at phase 2 and homegrown to y'all is Platteville, Wisconsin, and their Idea Hub Accelerator, which maybe y'all are familiar with, but as mentioned, University of Wisconsin-Platteville won the Build to Scale Award in 2020 and has done an incredible job putting the funding to use with the launch of their first ever Tech Startup Accelerator program, an 8-week program designed to help startups from Southwest Wisconsin grow and scale. Their first cohort took place from June to August of 2021 with 12 promising ventures, and the program includes matching entrepreneurs with expert mentors and curriculum delivered by guest experts, and they're continuing to expand these programming efforts and see graduates of their program, I'm sure, soon raise capital. And as that happens, they would be really moving up right into phase 3, where, as I mentioned, we have Cape Girardeau, Missouri in their program, which is just absolutely rocking and rolling at this point. They've been underway now for many years. After they won a Build to Scale in 2019, they've been able to launch over 50 startups, which have raised a combined $30 million, contributing to creating over 180 local jobs. And that's the kind of impacts that we expect to see as well in Platteville and beyond Wisconsin, other rural areas that we continue to work with. And these examples just stand to demonstrate that support, again, it looks different depending on where communities are in their startup journey and maturity, and that providing them with funding, technical assistance, and partnerships really can help offer to grow and expand what they can do for local tech entrepreneurs. There is always more work to be done to grow a startup ecosystem, but with concerted efforts and a clear vision for what a local tech entrepreneur's journey will look like, the possibility of creating homegrown wealth and jobs through tech entrepreneurships becomes truly real. So with that, I just want to thank you all so much for your time and for your attention, and encourage you all to get involved and learn more about our work if you're interested by checking out our newsletter. And also, if you want to work directly with rural entrepreneurs, you can apply to join our Mentor Network, which is a national network that we support to connect rural entrepreneurs with folks all across the country. So thank you again so much for your time and for your attention and for your dedication to supporting economic development through tech entrepreneurship in rural America. It's been wonderful being here with you today.
Wonderful. Thank you, Molly. And we'll drop, again, these slides will be on our website, and we will also drop the URL for their website in just a moment. Our next presenter is Marie Berry. Marie is the Director of Community Economic Development with Rural Wisconsin Health Cooperative. Marie leads RWHC's effort to help rural communities utilize one of their greatest assets, their hospitals, as a driver of economic development. RWHC's Community Economic Development Program works to better integrate healthcare leaders with existing economic development networks and initiatives, provides training and education on economic development issues, and offers local technical assistance on community-specific challenges and projects. And today, Marie will discuss rural health care trends in Wisconsin. The floor is yours.
Thank you. Okay, just confirming my slides are good for you guys.
Yep, we can see them.
Awesome. Thank you for having me this afternoon. I really appreciate the opportunity to talk with this group. So as Brandon said, my name is Marie and I work for the Rural Wisconsin Health Cooperative. So if you're not familiar with our organization, we're a true cooperative of 45 rural hospitals. One of my favorite facts about our organization is that when we first formed, we took Cheese Cooperative bylaws, crossed out farmer, and wrote in hospital. So we have very rural and very Wisconsin roots, and we've grown from about 6 members in 1979 to 45 members, truly in every corner of the state that's rural today. So today I wanted to hit on 3 main topics with you guys. The first is sort of the state of rural healthcare in Wisconsin, right? Our healthcare infrastructure has been highlighted coming out of a global pandemic. So where does Wisconsin stand? How are we doing? Next, I wanted to talk about how hospitals and rural economies are linked. And then finishing up, discuss how healthcare depends on and is a partner for economic development, especially in rural communities. So overall, what is the state of Wisconsin's healthcare? We're super lucky. Wisconsin has a really strong rural healthcare infrastructure, even coming out of the COVID-19 pandemic. So one of the metrics that is often used to define the strength of healthcare infrastructure in rural communities is hospital closures. So Wisconsin has been really lucky to avoid many of the hospital closures that other states throughout the country have seen. So as this map shows, this is all of the rural hospital closures within the country since 2005. And the majority have been clustered in the southeast portion of the United States. Wisconsin has had 1 rural hospital closure in that period, which is very small and really speaks to the strength of our rural healthcare infrastructure. So why do we have this strength? Why has Wisconsin avoided this challenge that's occurred in other parts of the country? We have a lot of rural hospitals, which is positive because, you know, they're stronger together. They can network together and better advocate for themselves and better support each other. We have a higher median operating margin, which lends more financial stability to our hospitals and therefore to our healthcare infrastructure. And that was really important going into COVID because COVID threw hospitals for a financial loop. So having that higher median operating margin and lower negative operating margin in comparison to other portions of the country was a huge asset for our rural hospitals. And Wisconsin's rural hospitals are frequently acknowledged as some of the best in the country. So just 2 weeks ago, the Chartis Center published their annual listings of the top rural hospitals in the nation, and Wisconsin had 13 that made the list. So we have a lot to be proud of in terms of our rural healthcare infrastructure. And I wanted to call your attention to one specific hospital on this list, because later on in this presentation, we'll be able to compare and contrast it with a similar hospital in another part of the country. So Black River Memorial Hospital is the only hospital in Jackson County, and it is located in the county seat. That doesn't mean, though, that we don't have challenges that are facing our rural healthcare infrastructure. Earlier today, we learned a lot about the demographics of Wisconsin, our population and our workforce, and some of those same trends are concerning within the healthcare field. So the economic and demographic shifts that we're seeing across rural communities lead to lower patient volumes, more challenging patient mixes, and workforce shortages that are pressing concerns among our rural hospitals that we need to be proactively addressing in order to ensure that we sustain the strength of our rural healthcare delivery infrastructure. But first, I wanted to take 1 minute to just acknowledge what the impact of COVID-19 has been on our rural hospitals. So obviously, we're hopefully coming out of the worst part of the pandemic, and our hospitals are getting a little bit of a break, but it was a severe challenge for many of our rural hospitals. And I wanted to just take a moment to discuss what the challenges that COVID-19 brought to our hospitals were. So 4 main things. As any of you who live in a rural community have noticed, or as any of you who have eyes have noticed, there's been some division over public health practices. And as economic development practitioners, you probably all know how social cohesion and sort of that community development aspect is very important to accomplishing things within your communities. And that is the same is true for rural hospitals. It's very challenging to provide high quality healthcare when your community has strong divisions over public health practices. And in order to combat that, we've seen some of our hospitals come up with really innovative care delivery strategies over the last 24 months and build new community collaborations that they probably never thought they would. One of our hospitals gave away, as an example, free tickets to the local tractor pull for every person who got a COVID-19 vaccination. I don't think that hospital prior to the COVID-19 pandemic would tell you that was a strategy they were going to be employing. And we had other hospitals that were going out into the community to county fairs, to dairy breakfasts. And, after you'd pick up your milk and your eggs and your ice cream, you could also get a COVID-19 vaccine while you were in line. So some of those community collaborations and care delivery models are positive lessons that have come out of the COVID-19 pandemic that we assume will outlast the pandemic. And the next two I wanted to hit on are the financial vulnerability that many of our hospitals faced and the spotlight that the pandemic put on workforce shortages. So the pandemic really escalated or lower patient volumes, more acute patients, and a pause on elective surgeries and outpatient care. And most of our hospital leaders would tell you that is a perfect storm for their financial sustainability. Not having very many patients coming through your doors and having only very sick patients come through your doors is very challenging. So that stronger operating margin that our rural hospitals had in comparison to others throughout the country going into the pandemic was really important. And in some ways, the pandemic has been a blessing in terms of shedding light on workforce challenges that we knew were coming in the future, but have now been highlighted and in some ways sped up so that there's a greater awareness about these workforce challenges and more of an appetite to address them. Because as we saw earlier, there's no magic baby boom coming in Wisconsin's rural communities. So it's vital that we quickly and seriously talk about what our plans are to ensure we have adequate workforce to provide critical services like healthcare within our rural communities. Workforce is definitely both a persistent and an emergent challenge in today's healthcare landscape. And I could probably spend my whole 25 minutes talking about the challenges of rural healthcare workforce in Wisconsin, but unfortunately they only gave me 25 minutes. We're going to have to keep moving on. So I wanted to point you guys to this report. It's linked in my slides, and I would really encourage you to take a look at it. It has very relevant Wisconsin-specific information, and one of the highlights of the reports that really calls out the seriousness of our workforce shortage issues is that our state is going to be 16,000 RNs short by 2035. And there's other professions within the healthcare field that also will have shortages, but this one will definitely be the most critical and will have the largest impact on care delivery in rural communities. But that doesn't mean that there aren't solutions, and it doesn't mean that Wisconsin's rural healthcare providers are, standing by waiting for a magic baby boom that isn't coming. We're definitely taking action and looking at how we can take the workforce that we do have and better train it, better cross-train it, make it more flexible, more adaptable, and better suited to care for our rural population. So I want to transition now out of talking about COVID and into discussing why does your rural hospital matter to your rural economy? The most obvious answer is that hospitals provide healthcare. And in order to have healthy communities, we have to have healthcare providers present within those communities to provide both preventative and acute services for our community members. However, hospitals provide much more than just healthcare, especially in rural communities. They have an outsized economic impact. They're often one of the largest employers within rural communities, and the preservation of local healthcare access also helps preserve your local economic base. So some of the things you might not think about: the presence of a hospital within your community contributes to your local retail sales and the number of retail establishments that exist within your community. And it also helps ensure that your local businesses are thriving by both the jobs and the salary and wage expenditure that hospitals contribute to local communities. So earlier, if you will remember, I called your attention to Black River Memorial Hospital. And I told you that they were located in the county seat of Jackson County and that they're the only hospital located in Jackson County. So the picture on the right is from my home state of Georgia, which has seen a number of rural hospital closures. And similarly, this photo is of Southwest Georgia Regional Medical Center in Cuthbert, Georgia, which was located in the county seat, and it was the only county or only hospital in the county. Located in the same city as a small college, and they unfortunately closed in 2020. So that community is now without a hospital and facing long drives to the next available care provider. So that just really speaks to similar communities that had really different outcomes with their local hospitals during the COVID-19 pandemic and coming out of it, and to the strength of Wisconsin's healthcare delivery system, which is important because when your rural hospital closes, you're not only losing healthcare services, you're also losing really good jobs and income coming into your community. You're seeing your unemployment rate rise, you're seeing your local income fall, you're seeing median rent values decrease. So the strength of Wisconsin's rural hospitals helps the strength of our rural communities and their economies as a whole. And I stole this lovely chart from one of our speakers earlier today, Dr. Steve Deller, and it shows how Wisconsin's hospital and healthcare employment is growing. And additionally, these are really high-paying jobs within our rural communities. So as Molly spoke about bringing high-wage jobs into rural communities, I couldn't help but think how relevant her presentation is in the healthcare field, because healthcare jobs bring high wages to rural communities. So this is just an example. Many of you may know where Darlington, Wisconsin is in Lafayette County. So they're down on the southwest portion of the state. If you look at healthcare wages in Lafayette County in comparison to the average workers' wages, you'll see they're significantly higher. And this holds true across most rural Wisconsin counties. So finally today, how is rural economic growth and development linked to access to healthcare? So when Brandon introduced me, you might have noticed that my title is the Director of Community and Economic Development, and I work for a cooperative of hospitals. So it's a little odd. Why do our group of rural hospitals feel it's important to have an economic development practitioner on staff? And the simplest answer to that is because rural healthcare providers can only be as economically viable as their communities. So if rural economies are struggling, rural healthcare providers are also going to struggle to continue to keep their doors open and provide high quality care to their communities. And so there's many motivators that exist for rural hospitals and rural healthcare providers to become engaged in local economic development work. The first and foremost is patient outcomes. And especially in rural communities, most often your hospitals are neighbors taking care of neighbors. They're incredibly invested in positive outcomes for the patients they see, because those are the same people they see when they take their kids to school and when they go grocery shopping. They're really tightly linked with their communities. And within healthcare, there's been sort of an evolution in how we think about delivery. So instead of, sitting within the hospital and waiting for sick patients to come through their doors, many of our hospitals are now going out into their communities and proactively trying to keep their community members healthy and prevent those sicknesses that they treat from ever happening in the first place. So some of you may or may not have heard the phrase, the social determinants of health before, but most simply, the social determinants of health are the conditions in which people are born, grow, live, work, and age. So if our hospitals can positively affect the social determinants of health, they can create better patient outcomes. And similarly, many healthcare providers are moving more towards a value-based care delivery system, which again goes back to, rather than treating illness, working to proactively keep people healthy and lowering the cost of healthcare through that model of care delivery. And then the second motivator for our rural hospitals to engage in economic development work is financial sustainability. And I think often this gets a bad rap. When you talk about profit, people think, dirty capitalists, but that is not accurate when it comes to rural healthcare. in order for our rural hospitals to keep their doors open within their rural communities, they have to be financially sustainable. If they're losing money, eventually they're not going to be able to provide care to those communities. And as we've talked about earlier, that will have negative health impacts and negative economic impacts. So it's really important that rural hospitals remain financially sustainable. So some of the things that threaten financial sustainability within rural hospitals include payer mixes that are more challenging. So this would be more uninsured patients, more Medicaid patients, and fewer patients who are truly able to pay for the cost of their care. Other things that threaten financial sustainability within rural hospitals are demographics. So when you're seeing sicker patients and you're seeing patients who are older, they generally have more healthcare needs and are going to put more stress on your healthcare system, making it harder to care for your community and keep your community healthy. And additionally, higher acuity patients generally require more expensive care. This is a chart from the County Health Rankings Program at the UW Population Health Institute. And for some of you who work in healthcare, it will be old news, but for those of you in economic development, it might be new. So the purpose of this chart is to show what contributes to health outcomes. So often when we think about health outcomes, we think about healthcare, right? However, clinical care only accounts for 20% of an individual's health outcomes. So you can have the best hospital, the best clinic, the best physicians, and you're still only influencing 20% of that person's health outcomes via the clinical care that you're providing. However, the social, economic, and physical factors within the community that you live in are influencing 50% of an individual's health outcomes. So when you're talking about education, employment, income, housing, transportation, all these items that if you're an economic development professional, you're probably nodding along. Yep, I talk about those things every day in my community. Those are the same ways that our healthcare providers can work within their communities and with their patients to create better health outcomes. And this is a different model about the social determinants of health, but a similar outcome, showing that the healthcare system itself, meaning the physical buildings, and the insurance coverage and the care that's provided within those systems accounts for a small portion of health outcomes, whereas your economic stability, your neighborhood, your education, and the community you live in has a much larger impact on an individual's health outcomes. So hopefully this explains to you why our hospitals are interested in getting more involved within local community and economic development initiatives, because it truly is the best way for them to improve the health outcomes within their community. So as I said earlier, I'm so grateful that those individuals went before me and talked about Wisconsin's demographics, because we have a fairly good understanding as a group now of the aging and shrinking populations that are occurring within Wisconsin's rural communities. So what that means for our hospitals, when they have an aging population, they're seeing more utilization of their healthcare services, and they're seeing more chronic illnesses. So older adults are more than twice as likely to require hospitalizations compared with adults in their middle age. And by 2030, it is projected that more than 60% of baby boomers will be managing more than one chronic condition. So all this adds up to more stress on our healthcare system within rural communities. And then when you couple that with shrinking populations, it means you're seeing lower volumes. And as any of you who operate in the business world know, it's often more challenging to provide a service or care when you're doing it in lower numbers. It has higher costs associated with it. So these aging and shrinking trends within Wisconsin's demographics lead to less economic activity. And when you're talking about the healthcare effects of that, you're seeing more uninsured individuals and more individuals insured via Medicaid. And you're seeing oftentimes lower reimbursement rates for our hospitals, which are challenging. And these are trends that we know are occurring within our rural communities that our hospitals want to be proactive about stemming and turning around within their communities to ensure that Wisconsin can sustain our legacy as a strong network of rural hospitals. So many of our hospitals have been working to build better bridges within their communities between the healthcare and economic development fields. And this is interesting data from a member survey. So as I said earlier, we have 45 rural hospital members in every corner of the state. And when I first took on this position about a year ago, we did a survey to see what were their pressing concerns within their community outside of their healthcare delivery. So obviously our rural hospitals are well equipped to provide rural healthcare. However, outside of that, what do they see as challenges? And for most of the economic development practitioners on this call, I think that you will see that these are the same things you're working on in your communities now. So know that your hospitals are ready-made allies for when you're working on expanding broadband or bringing more housing opportunities into your community or talking about the availability and affordability of childcare. So I will wrap up. I think we have about 4 minutes left for questions if my timer is correct. And I see there's a lot of items in the chat, so I can start to work through those.
Wonderful. Thank you, Marie. And for some reason, I can't turn on my video, so you're gonna have to just go with my voice. That was wonderful. And there we have quite a few URLs that are being dropped in the chat, along with some great information. This information we will include as part of our with our website. So we'll put up PowerPoint presentations and any relevant links that folks are putting in, so you can capture those at a later point. So thank you. Next, we will move to Ruth Schmidt. Ruth is the executive director of the Wisconsin Early Childhood Association. For 20 years, Ruth has led Wisconsin Early Childhood Association, Wisconsin's largest membership and service organization for early childhood educators. Ruth is a leading voice on both state and national levels for strengthening the early childhood education workforce through policy and systems improvement and the greater public investment. She serves on Governor Evers' Early Childhood Advisory Council and Congressman Mark Hogan's K-12 and Early Childhood Education Advisory Group. She is the recipient of the 2019 Community Changemaker Award by Community Shares of Wisconsin. And today, Ruth will be discussing childcare trends in rural Wisconsin. Ruth, the floor is yours.
Thanks so much. Can you hear me okay? All right, good. You can advance to the next slide, please. So I'm Ruth Schmidt, and I grew up literally blocks away from the Chicago city limits. Many of my formative years as a child were spent summering in Manhattan while my father finished his doctorate degree. My high school was about 4,000 students. We had armed truant officers. We had bars on the windows, and this was in the 1970s. My reality was incredibly far away from what rural reality is, or was even at the time. I literally had never seen a cow run until I went to the cornfields of Iowa for college. And it was years into that education when I finally figured out that when I heard about bean crops, they were soybeans and not green beans. So with these roots, I just want to say how pleased I am all these years later to be speaking at this Rural Economic Summit, having dove deeply into rural childcare issues and solutions over my 20 years at WECA. Next. I cannot overstate how much I've learned and come to appreciate rural innovation. What I experience as unique in rural thinking and innovating is that it is not done, pardon the pun, in silos that so many of us struggle with in state and national considerations. It is all hands on deck. We take care of each other. We are community. Communities across Wisconsin, especially rural, have long recognized childcare as a key challenge. The pandemic has just exacerbated those challenges. Rural pragmatism, combined with a passion for localized solutions, has led to the formation of local coalitions across the state, two of which I will speak about today, dedicated to improving the lives of children and families, businesses, and communities. These are testaments to the power and resilience of rural communities. The Jackson County Child Care Task Force and Kickapoo Conversations are examples of what happens when local officials, community leaders, and concerned citizens come together to make meaningful improvements in the childcare landscape and improve local and state economies. I will describe the model of childcare shared services, the Wisconsin Early Education Shared Services Network, or WESN, as I'll come to refer it later, that received a top Rural Development Initiative Award from this group back in 2020, a model that literally never would have happened without deep rural community engagement and commitment. Next, please. I'm sorry, next, please. Thank you. Over 7 years ago, I sat in a crowded room at Vernon Memorial Healthcare in Viroqua with about 130 individuals from across Vernon and Monroe counties who literally volunteered their Saturday to meet with their neighbors for the launch of Kickapoo Conversations. In the room were pastors, doctors, electricians, farmers, teachers, bankers, manufacturers, car dealers, restaurateurs, and more. What do you want your community to look like for your children and grandchildren? And how can we work together to bring about bold change? Was the broad agenda for the day. This was community conversations with multi-county-wide buy-in to identify core issues and explore innovative solutions, which a couple years and literally dozens and dozens of meetings later led to the launch of the Wisconsin Early Education Shared Services Network. It started by serving 2 programs in Viroqua, 2 childcare programs in Viroqua, and it now serves over 1,000 childcare programs across the state, which is just incredible growth, all of which started in rural Wisconsin. Those conversations led to work with Prosperity Southwest, which funded a study to determine what childcare providers identified as their most critical needs and what models could best meet the needs that they had, eventually bringing childcare shared services to their 6-county region, which led to Greene County Development Corporation partnering to create Build It Strong, an 8-week childcare business practices course, which ended up securing funding from the Small Business Development Center and UW Extension to offer this 8-week course in communities across the state. Simultaneously, we joined and worked with the Jackson County Child Care Task Force, learning from business surveys and parent surveys that they completed to better understand their childcare challenges and to support them as they applied for preschool development grant funding through the Department of Children and Families to bring childcare solutions to their county. And these patterns go on and on. We know that you are living it. You know how challenging childcare needs in rural Wisconsin are. Today, I will set out a little bit about the scene that is happening in childcare across our state, share a little bit of data, which you already probably are recognizing, but I can't overemphasize that it is the leadership which rural communities are already bringing to this issue that pushes results in rural childcare forward. Yes, we need to understand the issue. We need to understand the data, but what you do when you return to your communities following our presentation is what's most important. Next, please. So what does the data say about what's happening in childcare? We know in Wisconsin that we have a gap of care over 117,000 slots. What this means is that there is 40% less care than what we need for children in our state. This is compared to the national average of 31% gap. The economic impact of this in Wisconsin is a loss of between $2 and $4 billion. This also means that many children aren't in safe regulated care settings, and thousands of families are balancing care options with work and household income demands. You might wonder, why do we have this gap? Why aren't more childcare programs opening? And the main reason is because childcare is a broken market. Consumers, parents cannot, and I would argue should not, pay more for care. Childcare programs are operating on razor-thin margins because they cannot charge enough to cover the true cost of care. If there were money to be made in this industry, we likely wouldn't see this kind of a mess in our rural communities and across our state. Wages in childcare are low, they're compressed, they hover around $12 an hour, significantly lower in rural regions and slightly higher in urban regions of the state. Benefits that many of us take for granted, like health insurance, are rarely available in childcare. Only 20% of early childhood educators that work in group childcare programs report having access to and participating in an employer-sponsored healthcare plan. We see high reliance on public assistance. Over half of the early childhood workforce in Wisconsin relies on at least one form of public assistance or another. Our system is failing, and the costs of the failure are dramatic to our economy and our communities. Next. If you look just at what the data says about babies in our state and the lack of care for infants and toddlers, which is absolutely one of the most critical pieces of gap that we see in rural Wisconsin, we know that that loss of care in Wisconsin represents an economic loss impact in our state of $1.1 billion. Next, please. I know all of you have heard about rural childcare deserts, where we have low supply and high demand. The map that you see in front of you, if you look for where you live and where you work, you will likely see a prevalence of orange and yellow dots in our most rural areas. Those are areas where there are at least 3 to 5 children for every possible regulated slot of care in the community. More than 70% of rural Wisconsin is considered a childcare desert. Next. On this slide, if you look to the red arrow, you will simply see that rural counties have borne the brunt of losses in childcare capacity over the past 15 years. The largest loss has been that of home-based family childcare programs. These are small programs operated largely out of women's homes. It's an absolutely critical model of care for rural Wisconsin. And we have seen a decline of over 70% of our regulated family childcare in our state. Next, please. So we have deserts, we have gaps. We also know that childcare is crazy expensive. This prices many families out of the ability to purchase what limited care does exist. The average cost of care for infants in Wisconsin is just over $12,000 a year. Again, slightly lower in rural areas and slightly higher in urban areas. This is unaffordable for a lot of Wisconsin families. For a family with 2 children needing care in Wisconsin, you can expect to spend over 1/3 of your household income. And of course, if you're a single mom in Wisconsin with a baby who needs childcare, you're left with about 17% of your monthly income to live off of for the remainder of the year after you pay for care for that child. Next, please. So what are the unique rural challenges? We know that rural parents spend more time and have to drive greater distances to get their children to care at about 10 miles for one-way access to childcare versus what is happening in urban areas of our state. Nationally, we know that we're only meeting about the need of 23% of families in rural areas for childcare versus urban areas where we're hitting about 75% of meeting the need of what we see in our nation. Next, please. You've heard a little bit about this. We saw childcare pop up earlier in the chat box. We know that childcare influences work and workforce participation. 86% of parents indicate that childcare has hurt their efforts or their time commitment at work. And this isn't also surprising considering the data that some of the economists shared with us earlier. Wisconsin leads the nation in the percent of babies with mothers in the workforce, with 70.2% of infants in Wisconsin having moms in the workforce, compared with the national average of 61%. Next, please. The Bipartisan Policy Center has been surveying parents across the nation for several years with a focus on rural perspectives. What they found is that 45% of rural parents indicate that they or their spouse provides childcare for their child. So they don't work outside the home, they provide that care. Of those who use care outside of the home, only 34% are indicating that they use regulated care. And for rural parents who are not working, 80% indicate that childcare responsibilities influenced or significantly influenced their decisions not to work. Next. The childcare crisis in Wisconsin has deep economic ripple effects. As Missy Hughes, CEO and Secretary of WEDC states, there is a direct correlation between Wisconsin's economy and Wisconsin's childcare system. And as reported by Chris Hardy, Executive Director of Seven Rivers Alliance, After conducting a childcare study of businesses and employers in the Cooley region, the lack of childcare is keeping people out of the workforce. COVID has exacerbated this reality. We currently know that 75% of childcare programs in Wisconsin are in a staffing shortage, with over 80% of them indicating that they struggle to hire people because of low wages. 30% of programs have classrooms that are currently closed. 40% have had to increase their wait lists. And we know that about 17% of programs in Wisconsin are considering closing during the next year alone. There have been and there will be many opportunities for communities and organizations to apply for funding to support childcare. We all know about the Wisconsin Innovation Grants that were recently released, and another round of those is coming. And I'll talk a little bit about a new initiative called Project Growth through Department of Children and Families a little later. The key issue that I want to bring to every meeting that I have with community leaders is to please do your planning on how to address your childcare needs, including those who are working in this field in your communities. The leaders in childcare deeply understand what isn't working, why it's not working, and what's needed to fix it. Solutions are not just about opening new programs. This isn't about bringing the bright, shiny new childcare facility to your community. Hopefully we'll get there in due time and we can see that kind of growth as it's done planfully. But right now, what I would say is the most pressing issue that we have in Wisconsin is the need to stand up the existing care that we have. We need to support the existing childcare workforce, especially in rural Wisconsin. We need a way to keep good educators in the field. We need to stop hemorrhaging, which is what is currently happening in childcare. And we need to make sure that administrators and childcare program directors are not emotionally exhausted from ongoing staffing issues, parents needing care so that they don't lose a job, COVID closures, and more. There has honestly been nothing sadder over the past 6 to 8 months than the stories that we continue to hear from childcare program directors on a daily basis about the shift from the deep, wonderful relationships where parents and providers felt like partners in a child's upbringing to very hard relationships right now that are centered on conflict that's pretty unavoidable in our current economy and in the current pandemic that we have in Wisconsin. Next. One thing we haven't talked much about today is the need for advocacy. Advocacy for childcare is absolutely critical. Part of the reason that we don't ever get to a lasting solution in childcare is because it is enormously expensive. Wisconsin puts the minimum general purpose revenue into childcare that is required to draw down our federal block grants. This may not be a politically popular position to take, but we need bipartisan understanding that childcare is state and national infrastructure, allowing parents to work, allowing businesses to be successful, and communities to be healthy. With an aging rural population, a decline in rural births, we need to attract and retain young talent, and we can't do that without thriving communities with affordable care for their children. WICA has a business engagement director, Kimber Lytle. She's been working to facilitate conversations between legislators and business and economic leaders across rural Wisconsin in collaboration with the Wisconsin Economic Development Association and Wisconsin Rural Health Cooperative. The need for this work and active participation from parents and businesses cannot be overstated. Next. So I opened this conversation by referencing rural communities leading efforts to address childcare challenges. I'd like to tie back to some of those and some additional local examples where local ARPA Recovery Fund dollars have been used to address childcare workforce challenges. In Door County, we saw a decision to allocate over $430,000 worth of their local ARPA recovery funds so that they could hire a full-time coordinator through their Door County United Way to support recruitment, retention, and training of childcare providers in the area. They also will be using funds to help with expansion of home-based family childcare programs. Richland County has invested their local ARPA recovery funds to ensure that childcare programs can apply for up to $150,000 in in ARPA dollars to cover operating, staffing, and building expenses. Jackson County set aside $105,000 of their local ARPA recovery funds to establish workforce stipends to be paid out on a quarterly basis to every early childhood educator who's working in direct care in their county. At the state level, we know that over $800 million has been set aside in COVID relief spending for childcare. Much of this is going directly into supporting the operations of childcare programs so that they could keep their doors open when many businesses were closing. Much of it also, an additional over $30 million, has been put into funds to pay out in stipends to people who are doing this work. And then finally, we've seen close to $14 million in funding to support the Wisconsin Early Education Shared Services Network. Again, this is this program that started in Viroqua through community conversations happening in the Vernon and Monroe County area. Next, please. So earlier I mentioned WESN. This is a program in my association. Again, we began it years ago with 2 programs in Vernon County, and we're now serving over 1,000 programs. So why is shared services critical, especially for rural Wisconsin childcare programs? Mainly because a lot of women come into this field because they're passionate about caring for and educating children. They don't necessarily go into this field because they're crack business minds, and they see it as a way to make big profits. And so what WESN does is it leverages community, state, and national partnerships to benefit local childcare providers, which allows for maximizing childcare program efficiencies. We have shared staffing, including a relief squad, which provides shared substitute teaching to childcare programs. We support technology systems and childcare management systems. We have accounting supports to do back office data entry for programs. We provide human resources and communication supports also for childcare programs so that they can focus on what they do best, which is caring for the children that is so desperately needed in our communities. Next. You'll see on this map, the blue area is where we are currently operating our Wisconsin Early Education Shared Services Network. The green areas are where we have current plans using the COVID relief funding that the Department of Children and Families is granting to us to expand our services. You'll see significant growth in northern Wisconsin, northeast Wisconsin. We would love to go beyond that, and we'll continue to push on those conversations with Department of Children and Families. Next. The other thing that I wanted to bring to your attention is Project Growth. This is a new state initiative within the Department of Children and Families, and it's been created to help Wisconsin businesses, communities, and early childhood partners to add services, look for solutions, and be innovative in your communities. To learn more about this project, you can go to projectgrowth.wi.gov. I'll tell you about that later because I'm now going to move on to talking about 2 key programs within Project Growth. So if you can go to the next slide, please. The 2 projects that Project Growth is launching in Wisconsin, the first is called Partner Up. Partner Up will be run through Supporting Families Together Association. It is a grant program that builds on the concept of public-private partnerships in order to contract for slots at the true cost of care for parents that are working in essential services industries. In this model, employers will be required to match about 25% of the cost of that slot, and then Partner Up with the funding from COVID relief dollars will pay the other 75% of that slot. The application period for Partner Up is coming on Monday, February 28th, and it closes on April 4th. And this is, again, an incredible opportunity to bring revenues directly in to support childcare programs in rural Wisconsin. So ensure that your rural essential services businesses are applying for this program. The other program that I wanted to talk about is called Dream Up. It's the second initiative through Project Growth. It's going to be run through First Children's Finance. Dream Up is also a grant-based program that fosters innovation and growth through community strategic planning, supply building, and collaboration. So this is a model where if you're already part of a local conversation and you're doing community planning, strategic planning about what can you do to meet the childcare demands in your communities, I strongly encourage you to consider submitting an application for Dream Up. That is where you'll get this technical assistance support. You get financial resources to support the planning that needs to be done in your communities to needs. Again, the application period for Project Growth is also February 28th through April 4th. On Monday, there is a webinar that will be offered by Department of Children and Families. It starts at noon on February 28th. And again, if you go to projectgrowth.wi.gov, you can get more information on it and you can learn how to register for this upcoming webinar. So again, please consider applying for those services for your communities. You can advance to the next. So this sort of completes my formal presentation. I do have contact information here, and I've included contact information for our two co-directors of the Wisconsin Early Education Shared Services Network. If you, your local communities, are interested in learning more about WESN and how you can bring it to your communities, please consider calling Paula or Kelly for more information, or you can contact me. And that wraps it up.
Wonderful. Thank you so much, Ruth. And if you have those URLs for any of the resources that you had mentioned, if you would drop those in the chat, I can try to search them out as well.
I will do that.
Wonderful. Thank you. So we are coming towards the end of the summit, and we are going to return back to Dr. Stephen Deller. And Steve will discuss trends in economic development policies and their relevance to communities, highlighting the importance of economic development planning. So, Steve.
Thank you, and thank you all for that are still on the Zoom. I appreciate your willingness to kind of sit through all of this information. I'm going to try to do something a little bit different here and kind of think a little bit about in terms of how we've approached economic development or rural economic development. And one of the things I want to say is Neil Flora, who is a sociologist at Iowa State University. She was on the Zoom earlier. I'm not sure if she's still here, but I've learned a lot reading some of her work. And I think it's, you know, when you get a sociologist and an economist basically agreeing on something, there might be something there. So I just kind of want to walk through how we kind of are thinking about economic development from a little bit of a different perspective. One of the things that we kind of fall into a trap of is that we tend to think that economic development is basically jobs, jobs, jobs. And I mean, this is just some quotes that I grabbed from politicians, former mayor that's running for the governor of Arizona, the mayor of London, even Trudeau, the prime minister of Canada. When they talk about economic development, they're talking jobs, jobs, jobs. That's their narrow laser focus. Even John Oliver has gotten in on the discussion about how a lot of our economic development policies are just really narrowly focused on jobs, almost to the point that we're losing sight of a bigger picture. And one of the things that I want to kind of talk about as we've shifted here a little bit is this difference between notions of growth and development. Historically, we tend to think in terms of growth. More jobs, more businesses, more residents, more tax base, more. I think there's been a shift, particularly at the local level, at the community level, that we're really trying to think in terms of economic development. We want a quality of life. Excuse me. We want economic security. We want economic opportunities. We want balanced growth. At the local level, we've kind of moved beyond to simply focusing on jobs, 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 despite the fact what a lot of our politicians are saying. We're thinking a little bit more deeply about this. really, I think what a lot of communities in Wisconsin and rural communities and many urban neighborhoods is that we're really trying to create an environment that maximizes opportunities, economic opportunities. We want to create an environment where people can succeed. And how can we do that? It's more than simply jobs, jobs, jobs. It's a deeper question than that. And as we've talked about, the labor shortage right now, we're having difficulty filling the jobs that we have. So we need to think a little differently. Okay. There's a long tradition in the US to try to influence economic growth. I mean, you can go all the way back to the 1700s when the state of New Jersey was trying to influence Alexander Hamilton to locate one of his manufacturing plants in the state of New Jersey. They were offering tax incentives. The Erie Canal was really an investment based on the notion of economic development. It was a cheap and safe way to transport agricultural products. In 1884, the state of Pennsylvania had invested $100 million and placed promoters of the state on the board of directors of more than 150 corporations. We have a strong tradition in the US of trying to promote our particular locality, our state, our locality. And a lot of times we do it by focusing on the businesses, okay? Now, we've gone through a number of different ways of thinking about this. And I want to focus on kind of the Great Depression up till today, okay? The first wave of economic development thinking is really focused on industrial recruitment, okay? And that can be traced back to the 1930s. And I'll get into this in a little bit more detail, okay? And that's still a very popular way of thinking about economic development. We can talk, though, in terms of that this is really not a very good use of people's time. Firms simply don't move around that much. But starting in the 1970s and really picking up steam in the 1980s was this notion of small business development. We need to think in terms of entrepreneurship. We need to think about those businesses that are our own backyard. So we started to see a shift away from industrial recruitment to focusing on small business development. Starting in the 1990s, we started to think in terms of public-private partnerships. The notion of Michael Porter's economic clusters came to the forefront. And we kind of see another kind of twist in how we start to think about it. I would like to argue that we're entering the fourth wave of thinking about economic development, and it can best be described as placemaking. And what I want to do is kind of walk through the logic and the history of where I think we are with this fourth wave of placemaking. Okay, the first wave, industrial recruitment. You can trace this origin back to the Mississippi Balancing Agriculture and Industrial Act. It was a policy established in the Great Depression era of 1933. And what Mississippi was doing is that they basically said, look, we're an agricultural state. We need to diversify. We need to move beyond agriculture and start looking at industrialization. And what they were really trying to do is try to convince manufacturers in the northern states to pick up and move down south, okay? The way that Mississippi approached this kind of established the idea of what is a positive business climate. And it's centered around four things: cheap labor, cheap land, limited regulations, limited taxation. If you talk to most folks today and you ask them, what is a positive business climate? These are the characteristics that you're going to be seeing, okay? This was the thinking from the 1930s. And it's still around today, although our economy is fundamentally changed, okay? So some say that this is the first shots fired between the new war between the states of business recruitment, okay? Unfortunately, we still follow this strategy. Wisconsin and Foxconn, it was basically a business recruitment, and we did it by throwing a ton of money at a company to get them to make that investment here. could talk more about Foxconn, but I think you know how that all ended. Amazon, when they put out their proposal for a new world headquarters, or headquarters 2, they basically put out a 13 or so page call for proposals. Basically, okay, we're opening up for incentive packages, and this is what we're looking for. If we had time, I'd talk about how South Carolina and Alabama basically went at each other to try to get a Mercedes plant to locate. Mercedes decided they needed the location in the US. South Carolina and Alabama started bidding back and forth. Mercedes had made up their mind they were going to Alabama, but South Carolina and Alabama got so wrapped up in winning the game that they kept throwing more and more and more money on the table. And Mercedes just sat back and said, "You're going to keep throwing money at us. We'll put off making the announcement." The game of recruitment it becomes such a fixation that a lot of times we lose sight of reality. And I think that in time, over the coming next couple of decades, I think Foxconn will be a classic example of how not to do it. Okay. Now, these are some quotes that I've pulled off of various state economic development agencies, and I pulled these a year ago. So some of the things that are underlined here: Texas, we have the best business climate in the nation, one of the lowest tax burdens, tax reliefs, right to work. Right to work is basically a way to remove power from unions, labor unions. It's in essence a way to keep labor costs down. Okay, so here, low taxes, tax relief, will throw money at you, and our labor's really cheap. So they're kind of echoing the same stuff that Mississippi was echoing in 1933. North Carolina, okay, again, our state has the lowest corporate tax rate in the country. North Carolina's business costs rank amongst the lowest in the nation. There's less red tape and litigation in North Carolina. Okay, again, the idea is replicating what Mississippi laid out in 1933. Florida, we have a pro-business state tax policies, competitive cost of doing business, streamlined regulatory, right to work, tort reform, no personal income tax. Again, this kind of old way of thinking about economic development and business climate. Tennessee, same thing, right to work, lowest tax burdens, tort and workers' compensation laws. Okay, all of these things are aiming at kind of this first wave of economic development. Idaho, we keep our costs and taxes low. We remove burdensome regulations. I could go on, but I think you get the point here, is that we are still thinking of business climate and industrial recruitment the way that Mississippi laid it out in 1933. The problem, though, is that the notion that what was, the engines during this time period, the people kind of thought that the engines of economic growth centered on the Fortune 500 companies. What's good for General Motors is good for America. That's changed, okay? David Birch was the first to kind of find strong evidence that job growth does not come from large businesses, the Fortune 500, but small businesses. This work has been reaffirmed by some work that I've been doing with Tessa Conroy and a few others. This is net job creation for the US. And we've broken this out for Wisconsin. We've broken this out for Metro, non-Metro, and it's the exact same pattern. Job growth comes from two places. One is new business formation, that's the blue line, but also existing businesses. Now, existing businesses are not only adding new jobs, but they're also laying people off. They're shutting down, they're contracting. So for existing businesses, we want to look at that net change. New jobs added minus off jobs that are lost. That's the orange line. Notice that over this entire time period, net job gain from existing businesses is negative. All the job growth that we've been seeing, net new job growth, is from new business births. This is why the focus on entrepreneurship and different types of entrepreneurship is so important. And this is what David Birch pointed out. So we saw this kind of shift in terms of the second wave. This is taken from the Green Bay Chamber of Commerce in terms of their business retention and expansion program. What the chamber really wants to do here is to essentially focus on the businesses that are already in Green Bay. And this is many communities have these types of programs. And they can run from the fairly complex programs with detailed surveys to the fairly simplistic as a simple business visitation program. One of the things that I often suggest for smaller communities is that these business visitation programs, in the spirit of business retention and expansion, can build tremendous social capital within the community. Okay, it builds a stronger sense of community. It can also help community leaders identify potential problem areas that they can maybe put into place. So really the goal here is to create an expansion of existing businesses and the creation of new firms, entrepreneurship. Okay, so what are some of the strategies that have come out of this kind of second wave? Business retention and expansion programs, business organizations like chambers of commerce that allow for networking and professional development. What are the institutions within the community that allow local businesses to get together and learn from each other? Some of the work I'm doing with Tessa Conroy essentially is showing that these networking opportunities are vital for viable local businesses. You ever heard the phrase, it's not what you know, it's who you know? This is essentially what this is saying. So things like chambers of commerce that can provide networking opportunities can be extremely important. Professional development. We're going to have a breakfast. We're going to have a business-wide breakfast for people to network. Oh, and by the way, we're going to have somebody talk for 20 minutes on how to use social media for marketing, or what does the latest change in tax law mean to your business, or what is a banker looking for when they ask to see your business plan? That kind of professional development. Okay, technical assistance to pre-venture firms, newly formed firms, and existing firms. This is providing that help that a lot of businesses are looking for. A lot of businesses, people start and run their business because they have a passion for that type of work. A lot of farmers remain in farming because they're passionate about the type of work that they do. Okay. Not all of these folks are necessarily very good business. My brother, for example, does art conservation, is very well known for his work in art conservation, doesn't know how to balance a checkbook. There are a lot of businesses like that, and they can use help. Sources of financial resources must be proactively involved. This is where the bankers need to be at the table. I'm curious right now, maybe I'll ask Brandon later, is how many community bankers are joining us on this Zoom today to learn about rural development in Wisconsin? The bankers have to be proactive and be at the table for any kind of community discussion, because they're kind of holding the keys to a lot of the money. Seed money for business planning. This can oftentimes be the form of a small grant. Competitions, you hear people submitting business plans for a competition, and they win a grant of $3,000, $4,000, $5,000 to help further develop that business plan. Angel investors within the community. This is looking for potential investors in local businesses from local folks that live within the local community. Celebration of small businesses, kind of creating an entrepreneurial environment of saying that we embrace and we encourage our local businesses to be more actively involved. Okay. The third wave is this notion of private-public partnerships. And this is almost single-handedly due to Michael Porter and his work on the notion of economic clusters. The Economic Development Administration really embraced Porter's notion of clusters. So those of you that have applied for an EDA grant have probably seen lingering effects of this notion of things that came out of Porter's notion of clusters. This is the third wave. Okay, and this tends to make a lot of sense because if you look across the US, you kind of see that different types of businesses, different types of industries tend to geographically cluster. Look at cheese plants in Wisconsin. When Wisconsin first identified economic clusters, of course, dairy was one of the clusters. Paper was one of the clusters. And it makes sense for Wisconsin to be thinking in terms of how can we promote the dairy industry in the state of Wisconsin. It makes sense simply by looking at that. Okay, you can also look, there's a variety of them around the country that you can look at. One that's getting more attention is the wine up that's not showing up. That's wineries. That bottom map there, that's wineries. You can see California, you can see the Pacific Northwest. You're seeing more and more of them popping up in Wisconsin. A potential cluster is not only microbreweries and breweries, but also wineries and distilleries. We're seeing growth in that in Wisconsin. How can we be fostering that? Okay. The focus really is to, if you've got limited resources, okay, and you want to focus on existing businesses, you really want to try to zero on what your community has a comparative advantage in. And that's kind of what your clusters are. It's particularly with the idea to emerging new clusters, perhaps wineries, distilleries, things like that. Networking is key to a dynamic, vibrant cluster. Okay, this networking is really vital. Simply having a bunch of businesses that are in the same industry located close to each other isn't enough. There needs to be networking amongst those businesses, not collusion, because that's illegal, but networking so that these businesses can kind of learn from each other. This is where the public sector can step up and help to form these public-private partnerships. Okay. Invest in public institutions that can support the clusters. These are economic development corporations at the local level that are trying to facilitate this networking. It could be state agencies that help try to facilitate it and provide technical assistance. Okay, notions of social capital really come to the forefront here. And I could spend the next hour talking about how the difference between what's called a dynamic cluster and just a geographic cluster. Okay, but these public-private partnerships are really aimed at trying to forge that social capital.
Minutes left.
5 minutes? Thank you. Placemaking. Fourth wave. What I think we're going into the fourth wave is really kind of a focus on quality of life. And now, why am I thinking this? Do people follow jobs, or do jobs follow people? Historically, people follow jobs. So it made sense to focus on business development. Jobs, jobs, jobs. We create jobs, we create employment opportunities. People will move into our community to take advantage of those jobs. That makes, historically, that's kind of how it worked. There's growing evidence that jobs follow people. This kind of turns this whole notion of where do you focus your energy kind of on its head. Rather than focusing exclusively on businesses, jobs, 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 we want to start to focus on people. Okay. This goes back to that notion of entrepreneurship. We want to get people to move to our community and then promote entrepreneurship. Okay. Focusing on attracting people to live in your community, then business opportunities start to develop. It's a different way of looking at the community process. This is where the light went off for me, and also reading more of Neil Flora's stuff during the same time period, is I did a study with John Halstead back in 1997. And what we were looking at was small rural manufacturers, small, less than 100 employees in Wisconsin, Maine, New Hampshire, and Vermont. And it was an old paper survey, and we were interested in infrastructure, things like roads and telecommunications and airports and things like that. And one of the respondents wrote in the margin of the survey, find an area that you want to live, then start your business. All the data that was coming out of that survey was pointing to this. Small businesses tend to be located where they're located because that's where the owner lived when they started the business. That has huge ramifications. It particularly says a lot of this recruitment of the first wave, it doesn't apply. It doesn't work anymore. Okay, so we want to focus on good schools, not to feed the labor force, but to attract families with children. Public safety. Do I feel safe walking my dog at midnight? Parks and recreation, libraries, things that make this a nice place to live starts to move to the forefront. Community fairs, festival, things like art in the park, farmers markets, music on the square, farmers markets. I've done a lot of work on kind of local foods and its role on economic development and economic growth. Local foods really doesn't impact the local economy the way that a lot of advocates promote. The way local foods really impacts the economy is through quality of life. It makes the community a better place to live because you have local foods. So local foods, farmers markets, is really kind of a fourth wave placemaking type of strategy. Viable local business organizations, including professional development opportunities. Again, the strategy that came out of the second wave is perfectly viable here. Things like free public Wi-Fi, active volunteer organizations, early childhood education, creative networking opportunities for business owners and those interested in starting a business. Be open and receptive to newcomers to the community. This is where, if you were with us last year for our first Rural Economic Summit, and we had people talking about the Iowa Small Town Project, one of the major takeaways is why are some Iowa small towns doing okay? Is because they're receptive to newcomers and new ideas. It's very, very important. Okay, so do we basically replace the waves that come before? No, not really. Although I'd like to see industrial recruitment go away because it doesn't work. But industrial recruitment has a place because there will be times when a business does come knocking on your door and say, hey, we're thinking of moving into the area. Be prepared to respond to that. But going out and doing cold calling in Chicago and the Twin Cities is not a good use of your time. Okay, it's not replacing, it's rather a reorientation of our thinking and focusing on different strategies. Okay, one could think in terms of broadening our approaches. The key takeaway here is that rather than focusing our energy on businesses 100% of the time, we now need to say, no, we need to balance that a little bit more with making this a better place to live.
Steve, we are.
That's a good thing, sir.
Yeah, thank you.
And how's that for timing?
Great. Thank you, Steve.
So I should probably just jump in quick. This is so I'm Benoit Jacob. Can you see me? Folks see me all right? Am I on the screen? Perfect.
Yes.
Oh, there we are. Super. I guess I get the final word here. I do just want to thank everyone for attending this summit. I want to thank the presenters for their informative discussions and presentations. For what it's worth, obviously, rural prosperity, rural economic development is a high priority for Extension in general, the Community Development Institute that I direct, and of course, the Community Economic Development Programming space within the Institute that Brandon Hofstede is the program manager for. So we appreciate you all attending. To the degree you could use Extension support in your efforts, please feel free to reach out to anyone in Extension, but certainly to Brandon or Steve or Matt or Tessa or Kristen, to any of the folks that you heard today. So thank you all for your attendance and thank you for your great work in advancing economic development in the state of Wisconsin.